Ladies and gentlemen, a warm welcome to all at the PCQuest HealthTech Forum. COVID showed the true light where we are in terms of medical infrastructure, preparedness for the future. But one thing I must say, COVID has also opened the doors of opportunities for all, where technology took the center stage and marvelous interventions are taking place at a rapid pace. Today at PCQuest Health Tech Forum, eminent leaders and professionals will share their valuable insights and also emphasize on how technology should be revamped and made to good use for humankind. I would like to thank our presenting partners first, Dell Technologies, digital transformation partner Accenture, academia partner APG Education, and knowledge partner CIOL. At the very beginning, I would like to invite Mr. Pradeep Gupta, Chairman, Cyber Media Group, to start the PCQ Health Tech Forum with his opening remarks. Pradeep Gupta is the chairman of the Cyber Media Group, the specialty media house with brands like DataQuest, PCQuest, Voice and Data, Dare, CIOL, Global Services, etc. Pradeep was conferred the National Entrepreneurship Award as the best mentor by the Ministry of Skill Development and Entrepreneurship, Government of India. He is the chief mentor of Electropreneur Park, Delhi and Bhubaneswar. He is also an angel investor and has mentored over 250 startups, co-founder of the Indian Angel Network, Asia's largest angel network. Pradeep was also a global trustee of TIE, the world's largest entrepreneurial ecosystem. He chairs the IIT Alumni Trust, Ivy Cap Ventures. Pradeep was also the GP of India's first angel fund, Infinity Ventures. He was on the board of UTI AMC. He has been the past president of Pan IIT India and Association of Indian Magazines. He has been on the boards of IIT Mandi, Indian Newspaper Society, IIT Delhi Incubator, IIM Calcutta Innovation Park, and Lemon Tree Hotels. He is the recipient of the Distinguished Alumni Award of IIT Delhi and IIM Calcutta and the Helen Keller Award for working in the disability sector. Pradeep is an engineer from IIT Delhi and an MBA from IIM Calcutta. Over to you, Mr. Gupta.
Good morning, ladies and gentlemen. I welcome you to this much needed discussion that we are going to have today on health tech. Health tech has really come to the fore in the last couple of years. The pandemic, as we all know, accelerated a few things. And the most important thing was that it moved technology into the center stage. A lot of things where we had these blockages in our mind, essentially changed that mindset. And we immediately started looking at various kind of remote solutions, solutions that required social distancing and so on, contactless interaction and so on. And perhaps it was the tech sector, the medical sector that got impacted the maximum because of what happened in the last 2 years. Let's look at the different ways in which this has happened. Look at the way the government rolled out the entire program. In terms of, whether it was contact tracing initially, then after that, the vaccines and, linking your vaccination to, various kind of things and so on. If we start looking at devices, so many different kind of devices suddenly started coming up because of the use of technology. In the last 2 years, we have witnessed a lot of UV-based products for, cleansing like that. We've had devices coming out for all varieties of tests to be carried out at home. I'm not saying that these devices were not there, but suddenly they started becoming so very important in our life and started getting adopted by each and every person. Let's also look at the other part of the entire health ecosystem. Look at the hospitals. The way the entire hospital ecosystems started moving into technologies, right from, to ensure contactless interaction. You had robots at the reception. You had ways and means by which tests could be done in a contactless manner. Then in terms of handling the crisis, use of digital technologies for handling different kind of pressure points which are coming. The hospital ecosystem also revitalized itself and moved to a completely different kind of a plane. Look at the entire area of distribution. Everything moved online. You had suddenly various varieties of online pharmacies coming up where you could be delivered medicines anytime, anywhere. That entire ecosystem, the way it has got accelerated in the last 2 years, is absolutely phenomenal. Furthermore, if you look at the logistics, in remote areas, the use of drones, the use of the UAVs for spraying disinfectants and so on. That entire part of the ecosystem also changed accordingly. If we look at the way this digital transformation in the health sector has happened in the last 2 years, I have no hesitancy in saying that we can actually treat the advent of COVID, we can treat 2020 as a break in the entire cycle of health tech. That suddenly, from where we were to where we went, there was a massive leap that happened. And I think, we have constructed today's program, today's sessions to discuss what are some of these changes that have happened. And not just that, we are also going to be looking at what is the future going to be. Because if you start looking at the future, you will now find more and more technology coming into the health sector. You are going to look at telemedicine has been around for years, right? But you will now start seeing telemedicine moving center stage, moving and becoming very important part of our lives. Deep tech, perhaps robots, a robo-doc is probably still a few decades away, but robot-assisted stuff will start happening soon enough. We are also looking at this health stack. The government of India has put together health as a mission and is putting together deep technology behind that entire thing to ensure that there is seamless transfer of data, the health data across various, whether it is the doctors or the nurses or the pharmacists or the test labs and so on. So, there is a complete revolution that is taking place in this sector, which in the next 5 to 10 years. And we will be deliberating on some of these changes as well. So, sit back and enjoy the deliberations that are going to take place today. We have an absolutely fascinating lineup of speakers for you. We have people from the government, from the medical community. We have the startups. We have different variety of people who will be talking about what this new world of health tech is going to be. With that, Once again, I welcome you on behalf of Cyber Media. Thank you very much for attending to today's session, and I hope you gain a lot out of today's deliberations. Thank you very much.
Thank you, Mr. Gupta, for those encouraging words. I would like to now invite Professor Randeep Guleria, Director AIIMS New Delhi, for a very special address. Professor Guleria has done pioneering work in respiratory medicine and has several awards and honors to his credit. He is the first Indian to get a Directorate of Medicine in Pulmonary and Critical Care Medicine and was conferred with the prestigious Padma Shri Award in 2015. He is also a member of many key committees in the Government of India, including the Joint Monitoring Committee to monitor outbreaks of new diseases.
First of all, let me really thank PCQuest HealthTech for inviting me as a key speaker. I'm really delighted to be here. I think the topic that they have and the discussion that we're having today are very, very relevant, especially because of the pandemic and the lessons that we've learned during the pandemic. I think when we had the pandemic, when we start looking at healthcare and technology, we were really lagging behind as far as technology was concerned in healthcare. And that was because of multiple factors, predominantly a reluctance by health professionals to really adopt technology and change their ways, as has happened in many industries across the board. But I think all of that changed in the COVID era. And therefore, a lot of changes happened during the COVID, which really pushed the frontiers as far as health technology or technology in healthcare was concerned. First of all, because of the lockdown and the challenges that we had because of the lockdown, teleconsultation became something which was very, very important because patients could not really come to the OPD because of the fear of getting COVID. The lockdown had restrictions itself. And secondly, people with COVID did not know how to really reach out and find out the do's and don'ts in terms of management. And therefore, in March 2020, the government came out with the telemedicine guidelines, which actually had a framework and in a way legalized teleconsultation so that people could really get teleconsultations in a proper format. I think that was a huge step. And to take it forward, the government actually started the e-Sanjeevani program, which is also promoting teleconsultations across the country. And this is also doing very well. Digital health and technology was already there to some extent in healthcare. Ayushman Bharat is one example where technology has been used to provide care to a large number of Indians and who need in-hospital care. But I think along with that, we realized the importance of technology, and this actually led to a lot of advantages that we were able to really build in. One was when we had the huge surge of cases in the pandemic, using technology, one was able to really reach out to various hospitals. We at AIIMS started what we call eICUs, and we interacted with hospitals across the country. I myself probably have interacted with more than 550 hospitals, talked to doctors there, discussed management of COVID in ICU and sick patients, and came out with proper guidelines, support, and advice to people. And this led to the concept that we could even use this subsequently in the form of doctors who are present in one place being able to advise physicians who are not specialists in that area. You may not be a critical care specialist, but if you have a sick patient in an ICU, by using an eICU concept, you can see the patient's parameters, you can see the patient's virtually, you can see what are the drugs that the patient is getting, and be able to give comprehensive advice in terms of patient management without being physically present there. And by this way, specialists who are present in limited numbers could really advise a huge number of patients or hospitals as far as patient care was concerned. So I think this was a big step, and this became something which was acceptable and would really be useful even in the post-COVID era. Similarly, the use of artificial intelligence, neural network became very, very useful for people to really manage patients and to see how they could really start looking at various ways of being able to predict whether a person has COVID or not, or whether this is going to go into more severe illness, and how this could be taken to a next level in other illnesses also. I think this has a lot of advantages. We also then had this promotion by the government of the digital health mission, which in my mind can be a game changer, because this will allow everyone's digital health to be literally carried like an Aadhaar card. And this, if we can really get all the private sector and the public sector on board, then no matter where the patient goes, to the private sector, to the public sector, his health records will go with him, and therefore this will really avoid duplication. And as we move towards more and more non-communicable diseases in our country, diabetes, hypertension, stroke, chronic respiratory diseases, the digital health record becomes very important, because you have these diseases which are there for life. A diabetic has diabetes for life. A patient with hypertension has hypertension for life. And you need monitoring and close observation so that complications don't happen because of these diseases. We don't want person to develop diabetic retinopathy or diabetic nephropathy leading to chronic kidney disease and dialysis and transplant, or heart failure or stroke happening because of uncontrolled hypertension. So I think the digital health mission and this will really take things to a new level. Also, this technology can be used using artificial intelligence to be able to see whether we can use telehealth. Can we use devices like Fitbits, which patients have, and they can actually monitor patients remotely, and using artificial intelligence and algorithms, be able to predict an event before it happens. You have a person whose heart rate suddenly starts going up, his saturation starts falling, or there is some irregularity noticed in the ECG. Could that predict that this person is going on to an acute event, and therefore an alert could be sent to the patient, to the doctor, even to the nearby hospital, and thereby you could actually save lives, and it could be very useful. I think this is the next level that we need to really go forward. And there has to be training of the workforce, in my mind, if all of this gets adopted. One of the reasons why we were not able to have transformation in healthcare as far as technology was concerned is because we need to get everyone on board, especially the users. And I feel that whenever we have technology coming in, it has to be user friendly. So doctors who are going to really feed their data in, who are going to use this, have to be comfortable with it. Other healthcare workers, even whether it's an ASHA worker, has to be comfortable with the technology that we're trying to use, and they should be able to accept it, and it should be user friendly. At the same time, this technology could really help allied professionals who may not be healthcare professionals per se, help the system in providing care to patients who are in rural India and remote areas where healthcare is not up to the standard. And by this, we could actually improve healthcare in that area. So I think there is a lot that can be done as far as health and health technology is concerned. And therefore, I think we are in a position where we need to push it forward. COVID has taught us a lot as far as the utility of health technology is concerned. I just hope that we're able to sustain it as we move away and start seeing COVID becoming from a pandemic to an endemic disease. The lessons that we've learned during the pandemic of the power of technology in healthcare should get translated to long-term sustainable solutions that our country needs in terms of healthcare in remote areas, in rural areas, so that there's equity in healthcare. Currently, there is a lot of imbalance as far as healthcare is concerned in, let's say, secondary and tertiary cities as compared to smaller towns and in rural India. That inequity we need to correct, and we need to develop a mechanism that healthcare is there irrespective of socioeconomic status. No matter what be your status, you are provided good healthcare so that quality of life is good, and at the same time, the workforce remains healthy. So we focus also on preventive health. In our country, the focus, I think, also has to be a lot on preventive health, and health technology can really help in educating people, in making sure that preventive health steps are there, and for early diagnosis. In rural India, people don't get their blood pressure checked until they have a stroke. They don't get their blood sugar checked. So if we were to use technology to be able to do this so that we are able to screen patients, whether it be for chronic diseases or even for cancers, 60 to 70% of cancers are preventable. And many cancers, if detected early, are curable. But unfortunately, in our country, most cancers come in a late stage because of the fact that we haven't really focused a lot on preventive and early diagnosis. So I think that is where technology can really make a huge difference. And I really would congratulate the PCQuest HealthTech meeting that is being held here. And I am sure that this will really go a long way in getting people to brainstorm and find solutions which are sustainable and could really be a game changer as far as healthcare in our country is concerned. Thank you very much.
Thank you, Professor Guleria. Now I would like to call upon for the industry keynote, Ms. Satya K, Regional Sales Manager, Education and Healthcare, Dell Technologies.
Hi all. Good morning and thanks for having me here in this event led by Cyber Media and PCQuest on the theme that's making headlines, transformation in healthcare. Building human progress has been Dell's purpose, and with the pandemic, is there a better time than now? As I'm here, some of the leaders and among the leaders and veterans in the healthcare industry and innovative solution providers who stood up to the occasion, I would like to recall and thank them all for facing the crisis and the biggest IT challenge in keeping up with the demands. Your teams rose to the challenge and accomplished what just a few short months ago seemed impossible. As we move forward, if there is one question that every IT organization is asking, it's, are we ready for whatever comes next? When our company announced our 2030 social impact vision and moonshot goals in 2019, healthcare was front and center. Our founder, Michael Dell, announced we are looking at touching 1 billion lives by 2030. I'm very excited to see the role of Dell Technologies in going to play in healthcare as we team up with healthcare customers and partners such as yourselves. Our ability to impact healthcare trends and further complicated given we are in the middle of a data and technology explosion that is disrupting the healthcare industry. Healthcare is personal for all of us now. Healthcare is at the forefront and plays a central role in Dell's strategy. We can help you accelerate your transformation journey, no matter where you are, based on your own initiatives and budget. Over the next 8 years, we see that the data will zoom up such that we will become a planet with 163 zettabytes of data produced per year, connecting 8 billion people, 75 billion devices every 18 seconds. According to Forbes, up to 20% of the data will be critical to our lives, and the amount of data under healthcare organizations' control is skyrocketing, marking just the beginning of an exponential increase in patient health data. At Dell Technologies, we know that every organization's digital transformation journey is unique. We are getting closer to our customers by developing, co-working, and customizing solutions that best fit each organization's ecosystem. Our healthcare practice has domain experts and doctors as part of our strategy team, and they offer us the consultation, domain strategies, roadmap, and GTM guidance. Isn't that a great news? We work with customers of all scale, be it emerging, mid-size, or large scale, and of the healthcare categories like hospitals, pharma, healthcare, health tech, and more. We combine industry-leading capabilities, global expertise, best practices, and our ISV capabilities to deliver jointly engineered, tested, certified, and pre-integrated solutions that provide the highest level of performance, availability, security, and automation to best meet your application workload requirements. Dell Technologies is not just award-winning PC server and storage organization. Allow me to explain what Dell Technologies looks like today. We have an unmatched capability of technologies and services. We enable the multi-cloud world, software defining everything with VMware and Virtual Stream. We help customers transform, automate, and modernize their data centers with our Dell EMC infrastructure solutions and VMware. We enable workforce transformation with Dell Client Solutions, and we surround all of this with intelligent business-driven security from SecureWorks. At Dell Technologies, we offer pragmatic innovation and addresses healthcare's toughest challenges. Our framework or pillars that we are driving based on industry trends are modernized technology, connected workforce, virtual health, and personalized health. What do we do on technology modernization is something interesting you would be interested to know. We provide multi-cloud solutions. To take full advantage of cloud offerings, IT departments must first assess their workloads and applications to determine the best cloud model for each. They must also develop a greater understanding of where data is coming from and going to in order to achieve flexibility and deliver a seamless experience to providers and patients. We are partnering with some of the market-leading data centers and also providing as a service model for enabling our customers in building and refreshing their data center infrastructure. Next is our focus on health IT infrastructure. To propel your digital transformation, make sure your IT platforms are digital ready. When information is unlocked, it connects the healthcare experts in a healthcare community. It ensures that they have access to all available relevant patient information and speeds up healthcare delivery and increases patient satisfaction, compliance, and outcomes. To enable this, providers need the flexibility to turn traditional on-premise infrastructure into a private cloud and to operate across multi-cloud environments. A consistent infrastructure reduces infrastructure cost by 18% and security breaches or outages by 30%, according to a research conducted on behalf of Dell Technologies, VMware, and Intel. The third point under our discussion is high-value workloads that are key for applications like EMR and medical imaging. Workload optimization focuses around driving higher efficiency, availability, and performance for key ISV applications. This incorporates modern flash-based technology, advanced replication and availability services, and leveraging virtualization to drive a consistent set of tools across the application environment. For example, our Epic customers running on Extreme IO and VMAX All Flash have seen huge improvements in response time of the application. This makes the doctors and nurses' day more efficient as they are not waiting for data to update. The second pillar in our framework is connected workspace. We create healthcare digital workspace by simply and securely delivering and managing any application on any device with VMware Workspace ONE, an intelligent-driven digital workspace platform. Workspace ONE integrates access control, application management, and multi-platform endpoint management into a single platform and is available as a cloud service or on-premise deployment. VMware and Workspace ONE is integrated into all Dell and user devices, enabling IT providers in healthcare organizations to achieve more with easier management of all endpoint devices. We focus on remote imaging and diagnostics. With rapidly changing work environments and the need for a more flexible workforce, healthcare is now implementing new revenue streams that accommodate with these new modalities. Remote imaging and diagnostics can now be enabled with modern infrastructure and modern end-user technologies that have the capacity to transfer large data sets fast with high quality and security so that new digitalized patient information and diagnostic results can be accessed and analyzed by care providers independent of their location. Third point of a connected workspace is end-user trusted devices, access, and data. Empower your staff with secure on-demand solutions from device to the cloud. The way you care for patients is changing, and we are adapting our solutions to support you. By building flexible end-to-end solutions into your organizations today, your team can seamlessly adapt to a world that is constantly redefining. From remote patient care to tele-ICUs and AI-assisted workflows, which virtual healthcare solutions provide the opportunity for healthcare organizations to rethink their delivery protocols and workflows, which lead to our third pillar of framework, virtual health. There's never been a better time to embrace the fast developing benefits of virtual health. From increased access to care, improved patient outcomes, and increasing access to reimbursement and reducing overall cost of care, innovative remote care solutions are radically and permanently changing how our healthcare is delivered to achieve clinical and business ability to as we shift from response to recovery. Telehealth is playing an important role. Patients and providers are adopting telehealth as it becomes mainstream. Patients and their families value their flexibility to communicate with care providers at a time that is convenient from the comfort of their own home. As providers evolve telehealth services, they must continue to improve interoperability across the care gamut to gain a complete picture of the patient from all sources: EMR, AI, IoT devices, direct patient input, and more, whether the patient is chronically ill or seeking wellness guidance. Next is remote patient monitoring. Readmission cost per bed and patient management costs continue to rise over the time. Remote patient monitoring and virtual care technologies are helping hospitals lower readmissions through new preventive measures that allow analytics platforms powered by Dell Technologies to unlock your data for remote consultation and predictive medicine. The last pillar of our framework is personalized health solutions. We provide solutions for precision diagnostics. Enabling data for analysis and predictive analytics tools leads to potential new way to treat each patient's disease in unique and innovative ways. These technologies are enabling the ideas of personalized medicine into the realm of reality. For researchers, genomics, and life sciences organizations, our approach to precision diagnostics is unique and it gains from our experience in other industries, but looks for close partnerships to create reliable, secure, flexible, and robust technology solutions tailored to their specific needs. Dell EMC Ready Solutions for HPC tailored for clinical genomics helps customers to get the optimal IT infrastructure for today and tomorrow. That means creating solutions with scalable building blocks optimized to meet the needs of specialized clinical applications. Dell EMC Ready solutions for HPC are built on modular blocks that can be configured and ordered in a simplified process that enables you to scale easily to meet new capacity and performance demands. Dell EMC's extensive track record with server storage, networking, and service enables us to implement holistic solutions that work from day one with an eye towards the future. Last in our discussion today is digital pathology. As pathology workflows digitalize and care specialists leverages new technologies like AI and ML, new patterns and correlations are formed, which can lead to innovative care solutions. This digitalization process is underway, and modern IT infrastructure with access to multi-cloud digital infrastructure will help empower clinical teams with agile platforms, secure access, and expanded data interoperability to take advantage of this newly digitalized data. With booming industry solutions, data explosions, and health consciousness, healthcare is dear to us, and we are aligning with current trends and demands. I drive the charter for this key vertical for Dell India and would be happy to connect with you on your thoughts and any initiative that you are driving towards patient care, improved patient experience, faster access to key data that would make your service better and your vision towards serving humanity. Let's work together, and thank you for your time.
Thank you, Ms. Satya, for that overview. into the future of health tech, we are delighted to bring to you two industry stalwarts, Dr. R.S. Sharma, CEO, National Health Authority, and Dr. Devi Prasad Shetty, founder and chairman, Narayana Health, to discuss the future of Indian health tech. Senior bureaucrat and former TRI chairman Dr. R.S. Sharma is at the helm of the National Health Authority, an autonomous body which is responsible for implementing India's $1.43 billion public health insurance assurance scheme, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. He has served as the chairperson of an empowered committee for COVID-19 vaccine delivery technology platform, CoWIN. Along with Mr. Sharma, we have Dr. Devi Prasad Shetty, the world-renowned cardiac surgeon, best known for making cardiac surgery affordable to the common man. He initiated the concept of micro health insurance scheme in Karnataka, which eventually led to the Karnataka government implementing the Yashaswini scheme, a micro health insurance scheme for rural farmers. Dr. Shetty is the recipient of a number of awards and honors, most noteworthy being the Padma Shri and the Padma Bhushan Awards in 2003 and 2012, respectively. Dear audience, we would like to invite you to a free-willing fireside chat with Dr. R.S. Sharma and Dr. Devi Prasad Shetty. Joining the chat with them is Mr. Pradeep Gupta, Chairman, Cyber Media Group.
Good morning, delegates, for today's session on transformation in healthcare. And it indeed is we actually having this session because today we are celebrating, a landmark in terms of vaccination. Right? You must have seen in the newspapers today great announcements that are being made about the 100 crore mark having been crossed. So it indeed is a great day. And I think it's a great time for the health tech industry because, the last 2 years have been absolutely transformational as far as this industry is concerned. There are a lot of changes that have taken place. Biggest of that is the mindset change. So, a lot of places technology was there, but it was not getting implemented because of one reason or the other, some regulatory issues, some industry issues, and so on, but it was not getting implemented. But because of the pandemic, suddenly it accelerated a complete shift towards technology. And I think we have witnessed the change that has taken place in terms of, whether it is devices, whether it is innovation in innovative technologies, whether it is affordable healthcare, in terms of the entire infrastructure, the healthcare providers. It's been absolutely, the last 2 years have been transformative as far as this entire industry is concerned. And I've got two fantastic people to share, what has happened and what is the current and what is going to happen in the future. So, welcome Mr. Sharma and Dr. Shetty for today's fireside chat. Let me start by looking at the last 2 years. The pandemic redefined a whole lot of places. And Mr. Sharma, let me start with you. We were, of course, caught on the back foot, but then we reacted and we put tracing mechanisms and, we put together the entire vaccine program and so on. So would like your opening remarks on what really have been the transformative things as you see them for the last 2 years?
Well, thank you very much, Mr. Gupta, and good morning to all of you and Dr. Shetty. It's a pleasure and privilege to share the session with Dr. Shetty, who is I think doyen in the Indian medical space. I am basically a complete newcomer. I have never worked in my 42 years of my life or career. I have never worked in the health space. But then probably I am so lucky to be really working in this field. And at this particular point in time, when health has become so important and everybody has realized the importance of health. And the last 2 years or 1.5 years have been real trying period for our country and also for the whole world. As you very rightly pointed out, what has happened over the last 1.5 to 2 years is that while there have been real crises in the health space, there is one area which has really gained quite a lot of ground and which has become quite which has accelerated, adoption of which has accelerated, and that is information and communication technology. So take, for example, the digital payments. Now, because people were saying that the currency notes also have some virus and, so it's better to accept the digital payments. And of course, people are doing more things online and therefore digital payment acquired a currency. So the statistics of digital payment, if you look at them, last month we had 3.4 billion, UPI transactions, totaling more than 600,000 crores. So this is the level at which digitization has gone in the payment space. Similarly, on many other areas, we have seen more and more use of information and communication technology. The current example where all three of us are sitting at different places, and your audience is also sitting at different places in the comfort of their homes or their office, and we are connected together and virtually feeling as if we are sitting in the same room across each other. Now that's another example of how adoption of technology has happened. It's not as if technology has come in the last 2 years. Technology was there. Telecommunication, video conferencing, all these technologies were there, but they were not really acceptable and adopted. So somehow circumstances have forced us to adopt these technologies. And I think that is something positive coming out of this such a hugely negative stuff. So this is something I see as a very fundamental change which has happened. And I think this change should not be abandoned. It should not happen that, once the pandemic is over or its intensity reduces, or people start sort of thinking that, okay, this is there, but it will remain with us, as they say, in endemic or whatever other term they use. So it's like influenza, this whole thing will remain, but it will not be so fatal, it will not be so dangerous. And that is how, we can abandon the technologies which we have started using. That should not happen. I'm not saying that physical meetings should stop. I'm not saying that traveling should stop, the economy should stop. No, not at all. But I think wherever we can optimize on the travels, on the expenditures, and on other things, we must do it. And that, I think, I see as a great ray of hope. Now, for our country especially, it is very important because our country has the problem of accessibility of healthcare systems. Now, I agree that every service in the health cannot be delivered through technology, but I'm sure many services, except probably hospitalization, operations, and other kinds of things, everything can be delivered.
Mr. Sharma, on the delivery part, let me...
I understand. But what I'm saying is that from my perspective, I see this is a great time for us to start leveraging technology in a very big manner.
No, absolutely. And Dr. Shetty, yes, indeed, as Mr. Sharma said, and you have said several times that the pandemic is becoming an endemic and so on. But there are technologies that have moved in, right from whether it is the front office, when a patient walks into the hospital, we've seen robots being used and stuff like that, to whether it is the entire ecosystem of diagnostics and so on. So what are some of these tech transformations that are very stark in the last 18 months?
First of all, I would like to let Dr. Sharma know that he always looks at himself as an outsider for the healthcare industry. But I just want to remind him that every industry is disrupted by the outsiders, not the insiders. So the government has the wisdom to choose the right person to disrupt this industry, Dr. Sharma. So with your vast breadth of knowledge in other areas, we believe you will bring a breath of fresh air to this industry. First of all, Mr. Gupta, the 100 years from now, when somebody is writing the history of Indian history, there will be two periods. One is BC, that is before COVID, and other one is AC, that is after COVID. Because everything what we see in this world, in this country, will be dramatically different. Every aspect of delivering healthcare will undergo dramatic change. And that change, foundation will be built on the technology. Because compared to any other industry, healthcare industry is the ideal industry for digital disruption. Because this is one industry which runs only based on the data. When you hear somebody is unwell, 95% of the people who are unwell do not need surgery or they don't need any fancy intervention. The decision to treat them is based only on the history of the patient, what he is suffering from. That can be obtained online and by interpreting various data of medical equipments, which again the data can be transferred. That is, technically 95% of the illnesses can be treated online remotely. And that was possible around 18-20 years ago, before anyone could hear the cloud. What cloud was, everybody thought cloud is the one which brings the rain. I was sitting in this office here treating patients in remote locations of India, in Siliguri, Bankura, all the African countries, thanks to Indian Space Research Organization satellite. And this country has the capability to make all this happen. So essentially, we are blessed in living in a country which is blessed with the phenomenally skilled software engineers who can create amazing product. Only thing is, medical professional like us should have the patience to sit with them, understand, and ask them how they can help us to improve our day-to-day life with the patients, rather than dictating them what we want. So essentially, I am convinced that with the digital disruption, healthcare will become safer for the patient, and it will become accessible, and it will become affordable. I have no doubt about that. And I can tell you, Mr. Gupta, in the next 1 or 2 years, when you walk into a hospital, you will have a reception without any receptionist. Because all the work done by the receptionist would have been done previous day by receptionist staying at home online. And when you enter the ICU, there will be ICU with no intensivist. Intensive care unit without intensivist, because intensivist is at home managing the patient remotely with better outcome. There will not be few hundred people running around with blood sample and taking one IV fluid from here and there. Everything will be transported by very inexpensive robots, like virtually toy robots carrying material. Because it's today, with this kind of a vicious infections going around, hospitals are not safe for the people who are not going to touch the patients. So all this technological disruption will happen soon, and I'm convinced that that will happen in a country called India.
That's wonderful. And I think, India, our parents always sort of said either you became a doctor or you become an engineer. And today we are actually seeing the marriage of these two things taking place, technology coming in healthcare. So I think, yeah, indeed, it has a power of huge transformation. Mr. Sharma, now let me talk about the delivery that you started alluding to. And so, And especially in terms of affordability, because I think that's a very important issue. In India, so far healthcare is associated with affluence. So can we break that sort of a connection? And can it benefit rural India? Your views on the delivery?
Well, Mr. Gupta, I think Dr. Shetty has raised an extremely important question, and I would like to spend a little bit of time on that issue of data. I think very, very important part, because data today is the not only the raw material, it's actually the currency. It's actually the most important part. Data has been traditionally, the records, the previous records, previous diagnostic reports, etc. That is also a data, but that has been obvious data and information. They have been important. But in today's world, I think that has become very, very critical, because anonymized data at a massive scale can produce results and can actually draw conclusions and can really provide an expert advice, which actually can be much more valuable and less costly, and can provide a real help to the doctors in actually improving their own skills. So I think that's something which is very, very important. Talking of data in general from a global perspective, India's networks today, wheel or transport 8 exabytes of data. Now, exabyte actually is a very very large quantity. You have heard of megabytes, gigabytes, terabytes, petabytes, exabytes. So it's a huge, 10 to the power so many, I don't know how many powers is there. And our people are consuming data at the rate of 12 gigabytes per month per person. 12 gigabytes. In America, the average data consumption from the mobile networks, let me qualify that, because their consumption from the fixed line networks is much, much more. But from a mobile networks, it's very small, 3 or 4 gigabytes. People in India are watching films online, films on their mobile phones. Data is extremely cheap. Some time back, a few years back, data was 300 rupees per gigabyte. Today, the data is 7 rupees per gigabyte, 8 rupees per gigabyte. So imagine one film is at the best 1 gigabyte. So in 7 rupees, you can download the entire film and watch it at leisure, and you can distribute the film in your community and do whatever. So what is happening is we are producing data. Again, social media users talk of Facebook, talk of anything. This is there. Now the point is what this data could do. One would think that this is a useless data, but it is not useless data. It is that data due to which Facebook, Apple, Google are trillion-dollar companies. Their sort of worth is more than a country's total GDP. So this is what is happening. Now, why is it important from our perspective? You see, one very important part which we should understand is that such usage of data was being done in the Western world. But then what has happened, that in the Western world, the pattern of usage of this data has evolved over a period of time, and it has evolved in silos. So you have large proprietary systems which are closed systems, which are actually just doing things for the benefit and business. India has the advantage that we do not have many legacy digital systems. Whatever are there are still in a preliminary stage. Now we have the chance to leapfrog, because we now don't suffer from because bringing digital legacies is very, very difficult, let me tell you. Breaking digital silos is more difficult than breaking physical silos. So therefore, we have a chance to leapfrog, and we have leapfrogged, and we have a chance to enable utilization of the data to the person to whom it belongs. So we have an architecture called data empowerment and protection architecture. So a patient is in charge of his or her own data. It is at her consent and her direction that the data can be shared. It can be kept in her device. It can, and that actually is going to be, from the patient's perspective, it is going to be very valuable, because once that happens, then the cost of treatment will go down.
Yeah, and what sort of a time frame are we talking about when I know you've been working a lot on the entire health stack and so on. So, by what time would a UPI equivalent for health be available?
Look, UPI equivalent for health, it's a very common term. People have started using it, but let me caution, because UPI is a unidirectional, single dimension part, which is basically payment system. Just payment. Health is a multi-dimensional issue. So therefore, and the ecosystem partners in health are quite large numbers, different. You have the most modern hospitals in India, and you also have the hospitals which are just a small clinic and they don't use technology at all. So therefore, bringing together everybody on that ecosystem, convincing everybody, it's not a question of forcing anybody. It's convincing everybody that, friends, this is the right way to go. This is the way you will reduce cost. And if you reduce cost, you will benefit yourself and you will benefit the patient. So ultimately, all three terms which Dr. Shetty used, the affordability, the access, and the quality, all these three things will improve using technology. And the last question which you asked, coming back to that the
Time frame.
Time frame will be, it can be as early as a couple of years, or it can be as late as a decade, but that will all depend on how we are able to do this project together. And when I say together, it's not, National Health Authority or XYZ or Ministry of Health or Ministry of Health in the state. It's actually the entire ecosystem of our medical fraternity. And that includes the hospitals, the doctors, the nurses, the Ayurvedic system,
Sure.
the Indian system of medicine, the pharmacists, and everybody, including the manufacturer of drugs. Everybody has to come together. And I think we can do it. Believe me, we have huge amount of confidence. We have done things and we can do it.
No, absolutely. Dr. Shetty, at Narayana Health, you've been using, the patient records, etc., for several years. But I think, how do we make it? How do we get all the components of, whether it is the diagnostic labs, the pharmacies, and how do we? What are going to be the challenges? Do you think the industry is ready to adopt to those practices, and how can those challenges be overcome?
See, situation now is dramatically different than what it was, say, 10 years ago. We believe that the entire electronic medical record will shift from the laptop to the mobile phone. And every software in treating patients will be built on a mobile platform. We will leapfrog what the US and European countries have done, where all the EMRs are developed for the desktops. Unfortunately, doctors never sit on a chair for longer than few minutes. They're always going from the operation room to the office to the ward to the ICU, and to the labs. They keep on moving. So essentially, 5 years ago, if I told my colleagues that we can see the chest X-ray in a mobile phone and take a decision to do a procedure, people would have laughed at me. Today, it is a norm. See, most of the decision in our group of hospitals are taken based on the data coming in the mobile phone, and it is such a joy. I go to bed at now. I don't go to ICU. First of all, you may think, you don't go to ICU, you don't examine the patient. Every hospital has a policy that a patient in the ICU, doctor shouldn't touch. Only the doctors who are going to do a procedure should touch the patient. If I touch the patient without a purpose, I can give him infection. So the concept of touch, people have to reset themselves. Then, as I said, I go to bed at around 11 o'clock at night. Before I go to bed, I finish the ICU rounds because I have the patient's live cardiac monitor. I can see the patient in my phone. I know what the entire blood test reports are, what the other doctors felt. It is like a chat platform. See, the entire EMR will move on a chat platform because doctors take the decision to treat the patient by chatting with their colleagues. And the patient condition is very dynamic, it keeps changing. So if you have built the traditional EMR, like a transforming what you write on a paper to a digital format, it is not going to serve the purpose. So we built our entire electronic medical record on a chat platform. So there are 20 doctors in my team who are constantly interacting. So 11 o'clock, I finish the rounds. And if I have anything to say, I send a message in the chat box. By 4:30, I am up. I do the rounds again. I know exactly what has happened. Before I enter the hospital, I know exactly how each and every one of my patient is. So that patient is never away from me and from the doctors. This is, we are not talking about the future, we are talking about the current. And all these tools are developed by brilliant software engineers working in Bangalore. So these are the amazing things which will dramatically change. See, the like Dr. Sharma, what he's planning to do with the National Digital Health Authority, they are going to, these National Digital Health Authority expects all of us to put our medical data into a common storage space. When that happens, there will be a massive shift in the way patients are treated. I'll give an example. Every day, thousands of CT scans are done. Every day, thousands of MRI scans are done, angiograms are done. Now, when the test is done, we give the patient a CD. And believe me, the life of a CD is not more than 5 months to 10 months. It gets ruined before that. And once the images are lost, of course, as a hospital, we store the data. But believe me, not many hospitals have the capability to store the data in the cloud. It is very expensive. Now, if the Digital Health Authority allows all the hospitals to store the data, a patient has a CT scan today of the brain. After 5 years, he has another symptom and the doctor repeats a CT scan. At that time, the life-saving decision can be taken only if you have the two images to compare, which we do not have today. So this health authority is not only about convenience, it is about saving lives. This is one example. Like this, I can give hundreds of examples where dramatic things can happen. A patient who has a heart problem with blocked coronary arteries in Bangalore goes to Delhi, 2 o'clock at night in a hotel room, he gets chest pain and he goes to the hospital. And the first thing hospital doctors want to know is where your medical records are. And nobody carries a medical record. Whereas if he has the link for his medical data in the cloud provided by Digital Health Authority, with a touch of a button, the doctors can see the old ECG. And they know this ECG of today and the old is the same. So it is not an acute heart attack. So they may not give him a deadly medicine called streptokinase or one of those medicine, which can potentially kill him by bleeding into the brain. So essentially, we are not talking about government trying to collect the data. We are talking about the measure to save lives of precious lives using the technologies what are available. And this is the beauty of technology, how it will make a difference.
Yeah, so what essentially you are saying is that, the business forces, the market forces willy-nilly, and the benefit to the patient automatically will mean that the industry will digitize and will, use the data standards and so on. And it is not that it requires an incentive to be able to, put together it's going to be a good business decision for them to make. Am I right?
Mr. Gupta, I can tell you, within the next 3 to 4, maybe 5 years' time, smart software will make smarter diagnosis than doctors. Within 7 to 10 years' time, believe me, legally doctors will be mandated to get a second opinion from the software before starting the treatment. Because you look at the scenario, I see a patient in front of me, I look at the films and say, you need operation. Now, is it the final verdict? Patient has a right to take the second opinion. Today, to take the second opinion, he has to get appointment from different doctors in different cities. How many people can afford it? If my software based on the data can give a second opinion and a third opinion from the top doctors by using the data, why not we do it? Believe me, it will become legally mandatory for all the doctors to get a second opinion. Will it mean, will the software replace the doctors? No way. There are planes which can fly without a pilot, but how many of us want to get into a plane without a pilot? So essentially, what will happen is these tools what we develop will make us safer for the patient. It will make convenient for the patient. It will make the healthcare affordable, and this is the beauty of technology.
Yeah. So essentially, RoboDoc is round the corner,
Yes.
but in an assistive manner.
Exactly.
Saying, Mr. Sharma, what are some of the other technologies around the corner? Would you see a lot of virtual reality and that kind of thing being used? What about what are some of the changes that you are likely to see on the technology front?
Well, I think what is important is while there is the newer breeds of technology which will provide newer methods of treatment, of diagnosis, of interpretation of the diagnostic reports, etc. That is one part. The more important part is essentially digitizing the health space. And digitization itself will actually result in huge gains in terms of efficiency, in terms of accuracy, in terms of better diagnosis, affordability, etc., etc. So I think there are many low-hanging fruits, as they say, which are there, which should be leveraged to begin with. And as Dr. Shetty was saying that these will make things affordable. They will improve quality diagnosis, second opinions by AI systems. So one is that technology will improve the quality of healthcare, and what is happening is that the data itself and the ultimately look all these AIs and machine learnings people talk about, but they forget that ultimately these are nothing but certain technologies which are working on data. The more data you feed to them, the more accurate they become, the more fine-tuned they become, the more accurate becomes their analysis. So this is what is going to happen, because we are so data rich. We may be a poor country, but actually we can become so data rich. We are already so data rich. Only thing is this data has to be put into a framework so that it becomes useful. You can derive meanings out of it. You can find the data without, of course, violating the privacy and other kinds of concerns which people have.
Actually, that would be, I was going to ask you, what about the ownership concerns, the privacy concerns, the security concerns? How are those being addressed?
Right. So one is that, this is important. My other take is that there are a lot of inefficiencies in the operational part of various hospitals. And what I mean, let me put it this way: as Dr. Saab was saying that there will be robots carrying on the those equipments and tools, etc. What I am saying is that there are many processes themselves which actually can be optimized, made more efficient, and people should work, and technology can come to the assistance of those processes. That's what I'm saying. So we should use technology to improve the internal processes of the hospital, B, to digitize the health records and the data, and C, to actually put together a whole slew of technologies which as a software as service. So for example, today, a hospital may buy a software which basically does the analysis of the X-rays, let's say. Now, if India, the country, is going to provide that as a digital public good, then we can buy, or we can get a software or AI machine or AI system which actually can work software as service. So anybody sitting anywhere can just plug in his X-ray and then figure it out. I mean, his X-ray means his patient's X-ray, and figure it out as to and diagnose it and use that machine, not not buying it. So from a capex, you have converted that system to an opex, and that is how things must matter. And therefore, the establishment of a digital health platform, which is the Ayushman Bharat Digital Mission, acquires importance, because then as a country, we should be able to plan to basically provide these softwares and systems, the best of them, as service. And then you can have maybe 2, 3, 4 AI systems working together. And depending on how much accurate they are, and they will develop their own star rankings and other things. The most efficient ones will survive. The others will have to struggle, and others will have to compete. So I think we can provide a very beautiful, cost-effective model of service delivery. Coming back to the question of data security and data privacy. So one is the question of what is privacy? Privacy is ensuring that your data is not used without your permission. That's one fundamental part. So consent is actually the hallmark which should be taken before using the data. That's one very important part. And what we have developed in India is we have a digital consent token. We are, consent doesn't mean that you are going to write on a piece of paper to a doctor saying that now you can use my data.
Right.
It should be hassle-free digital token which I can provide, and then the data can be seen by the doctor. Otherwise, it will become a complicated thing. And India, fortunately, has designed and delivered and deployed what is called the consent artifact. So essentially, that ensures that the data cannot be used without the owner of the data. Now, in a data world, owner is a bit of a fuzzy concept, because data is infinitely divisible. It's not as if this pen is with me and this pen can be exclusively with me. It can't be with you. Data is something which can be with me, and an exact replica of that can be with you without loss of any quality. So therefore, the ownership in our context rests either with the hospital, where the patient was there, and hospital obviously has a right to keep that data, and also with the patient. Patient also has the right to keep the data and share the data. So sharing part hospital cannot do, but the patient should be able to. So this is the architecture, and of that architecture, we are ensuring that the data does not go without patient's part, this patient's consent. Secondly, the other question around security of the data. So the security of the data basically means that the place where you are keeping the data should be secure enough so that the data cannot be hacked. Now that we are ensuring by what is called a federated architecture, which means the data will not travel. It is not as if data will get deposited in the National Health Authority. No, it will be basically living wherever it is living. If it is in the Narayan Hridayalaya, it will remain in Narayan Hridayalaya. Patient will have the capacity and this thing to fetch it, and for that to happen, Narayan Hridayalaya will have to keep the data somewhere which it is accessible from, and that accessible platform can be provided by the government, can be subsidized by the government, or some other arrangements can be done. But that's how it should happen. So therefore, it is not as if the National Health Authority is going to collect all the data and put it together and become a super kind of storage or a storer of the data. That's not going to happen. So therefore, the responsibility of the NHA to that extent gets limited, because it's responsible only for the reference data, which is the data of the facilities, data of the doctors, data of the drugs. That data will remain with us, but the rest of it will all be demand driven. You can fetch it whenever you require it, and then it remains wherever it is. And the responsibility of maintenance of the privacy and security of that data will obviously lie with the data custodians, the data controllers, as they say in the data protection regulations, etc. That's how it is going to happen.
And Dr. Shetty, for that, would the entire, is there an upgrade required for the entire medical infrastructure in terms of skilling and so on?
Mr. Gupta, I just want to bring back the discussion to the fundamental stage. The fundamental situation today is a lot of private equity investors, a lot of companies are chasing various tools for building AI, MI, all kinds of fancy gadgets. But Where is the data coming from? Data has to come from the electronic medical records. And over 80 to 90% of the hospitals across the world, forget about India, do not have electronic medical records. Today, when we talk about a digital discharge summary, somebody at the time of discharge goes through the entire file and they type all the reports like a typewriter and give a digital copy. That is not EMR. So essentially, situation across the world, other than US and some European countries, is like people are building fancy vehicles for a transport. Somebody is building a two-wheeler, somebody is building a three-wheeler, somebody is building, the very fancy, very fast cars, trucks, everyone. But nobody has built the road. And road is the EMR. And unless we build the EMR, all this data, what we get, they are physically entered, manually entered by people, which cannot be relied on. This is the biggest problem. So unless we all get together and create an electronic medical record for the country, which is available and accessible to every hospital, we will never see this revolution what we are all dreaming of. And that can be done in a country like India, because the cost of building that electronic medical record is tiny compared to what it will cost in US and Europe. And once everyone starts using it with the input, it will become better and better. So we will be able to make products which will be used across the world. So this is a golden opportunity we have in the country to build this kind of applications. But these applications should be built getting massive input from the doctors, because doctors are difficult animals to handle. Because one of the fundamental principles what doctors accept in electronic medical record is that there should not be a keyboard. Because imagine if you are a patient sitting in front of the doctor, and as you are talking about the chest pain and breathing difficulty, if a doctor is busy typing, it is not a good experience. He expects you to look at his eyes and understand. There should be empathy. So essentially, all the technologies must understand that the doctors are not designed by God to type. So then you create a EMR which is based on the tapping and the voice, and once these things happen, there will be a massive shift happening. So we have a great opportunity for all the software entities, software entrepreneurs, to build this electronic medical record. And once without that, all the data and everything what we get is not accurate. You can't build any AI tool based on that.
Dr. Shetty, we are coming to the close of today's discussion. So, it's a very interesting thought that you've given, that, Indian software has powered the entire world. And it is the Indian doctors which are powering healthcare systems all across the world, in the US, all developing countries, everywhere. So is it time now for us to see the marriage of these two, and can India actually become the center for healthcare technology for the entire world?
See, I have no doubt about what is going to happen. I'll give a simple example. You see, the Facebook, one of the largest content owner, doesn't create any contents. Alibaba, world's largest retailer, has no inventory. Airbnb doesn't own any hotel rooms. The Uber doesn't own any cars. Largest healthcare provider in the world, it will not have any beds. It is going to be a software. And that software, I believe, will be developed in India. I have no doubt about it.
And closing remarks from you, Mr. Sharma, on, and especially, because you've worked at the grassroots level. So, would like to know how this has the power of transforming not just India, but Bharat.
Look, I am, one of those persons who believes that technology can solve many of the India's hard problems, if not most. There are many problems, of course, technology cannot solve, but I think most of the problems, many of the problems, or even, many parts of those problems can be solved by technology. If appropriately applied, understood, because technology ultimately has to interface with human beings, and technology without the understanding of human behavior, human nature, how does a person feels comfortable with using the technology is very, very important for us to replicate that idea, to really permeate that idea, to convince the person. As Dr. Shetty rightly said, that typewriter is, typing by a doctor is not what is desirable. In fact, to put it more generically, I would say data should be a natural result of an activity. Data entry or data creation should not be an activity in itself. This is very, very important to understand. So therefore, I think what is required is that we have appropriate technology appropriately deployed, and we should spend some time in its design. And that is why designing any system, for example, COVID we designed while we had to design it in a few days' time, but still we had intensive discussions on the usability, inclusivity, replicability, scalability, interoperability of the software. So that I think is very important. So designing systems is very important. Human interface of these systems is very important. And one last is that India definitely has the capability. We have done many things in the past, and now we have a huge amount of confidence. And we also think that, look, we talk of medical tourism. We are having, one of the most cost-effective system. We have the most qualified doctors in the world. So I think what is required is provide that a technology interface, technology support, and the power of technology to aggregate millions and millions of systems and really produce a wonderful experience for the ultimate customer, which is the patient. That I think should happen. And my belief, I also completely agree with Dr. Shetty that we can see a huge revolution or huge transformation in the health space, provided, again, this proviso is very important, provided we all work together, in a consultative manner. I must not think that I am the most knowledgeable person on technology. I can be knowledgeable person on technology, but then technology has to work with people, with the doctors. Technology for the health space will have to work with the health service professionals, not really technologists. But I also believe that the innovations nowadays take place at the intersection of two disciplines, and that two disciplines are technology and health. And I think intersection will really produce revolution. Thank you very much.
So in this AC2, as it were, the after Corona year 2, is when we are really witnessing this transformation of technology, and we are heading into a new era where it is not just within India but globally. Technology driven by Indian doctors and Indian engineers can actually have the power of transformation. Thank you very much. It's been a fantastic discussion. Thank you very much, Mr. Sharma. Thank you very much, Dr. Shetty, for a very, very invigorating discussion. Thank you.
Thank you very much.
Thank you. Thank you. Thanks.
adopt to these services. Things, however, changed drastically when the pandemic hit us. Mr. Karthik Rajagopalan, Chief Operating Officer, Manipal Health Enterprises, ladies and gentlemen, I would like to now draw your attention towards the inaugural session of the PCQuest HealthTech Forum. In the past decade, we saw technology pervade healthcare to initiate services like telemedicine, e-pharmacy, personal health management, home healthcare, and others. But both providers and consumers were slow to adopt to these services. Things, however, changed drastically when the pandemic hit us. Mr. Karthik Rajagopalan, Chief Operating Officer, Manipal Health Enterprises, is here today with us to discuss why the healthcare system must be equipped with technology to keep future pandemics at bay.
I think we're here to actually go ahead and discuss about keeping the future pandemics at bay. It's very important to go ahead and look at 2-3 things in this. The first, obviously, is our ability to actually go ahead and predict a pandemic. And that's immensely possible actually through technology. It's a wired world, and we'll definitely be able to go ahead and look at a lot of prediction around what's happening around the world and how serious is a particular disease pattern that has an ability to actually take control over the world, much like what COVID did. Moving over from prediction is maybe sometimes pandemics are unavoidable. And how do we actually go ahead and look at it becoming prevent it from actually being a global pandemic and probably keeping it completely localized. And that's where I do believe even in COVID-19, we had enough information around the outbreak in China. Had we actually gone ahead and sealed borders at that point in time, and actually gone ahead and looked at, ostracizing the hotspot for a while, we probably could have got away, in a better shape rather than this impacting, the whole world. So, from prediction to, some kind of prevention, it's important that we understand the context in which predictions have been made, or when the news outbreak happens, what is the nimbleness in each one of us to actually go ahead and look at how we're reacting to a news. I mean, we talk about intelligence, we talk about military intelligence, etc., receiving information. Sometimes we're probably a tad late in reacting to it. Sometimes we're actually going ahead and looking at, information that we receive and act on it pretty early. So the right kind of training actually for people who are part of the surveillance or part of this wired world in trying to, in times of trying to go ahead and get these kind of news, it's important that they understand and react to news basis a certain observed behavior. Unless they are trained, unless they are conscious, unless they are fairly observant, a piece of news that might appear very, very innocuous can actually later on turn out into, something very, very large. Exactly like what, happened in COVID-19, where we did have information, maybe the world was a tad late to actually go ahead and react to this, whole piece of news. Technology is going to play a very, very important role. And look at a country like India, which is demographically very, very diverse. How do we actually reach news across, or information across to the last person in the mile in the tier 3, tier 4 cities and below? So it's very important that we actually go ahead and use technology, but use technology in the language and medium that every citizen of the country understands and understands fairly well. Otherwise, it will be lost on him or her to actually go ahead and react to information when they actually start to go ahead and come in. If you start to see the last 18, 20 odd months where we've been actually going through this pandemic, there were pockets of brilliance, there were pockets of extreme intelligence with which we worked, and there was some pockets of mediocrity as well. And that's the mediocrity that we need to actually push away and start to go ahead and look at intelligence working fairly well. And that's, I think, where technology can really work wonders for us. Technology put into the medium or language that people understand, I think would be the best bet to actually go ahead and look at this pandemic. Obviously, we do not know what the next pandemic will be. We do not know where it is actually going to go ahead and start from. We don't know where it's actually going to go ahead and what's going to be the consequence. But it's important to actually understand that after this flu that happened in the last century between 1918, 1917, and 1920. This is probably the second one that has actually come into this extent where, it's actually caught all of us by surprise. And futuristically, if you actually go ahead and look at it, sometimes these cannot be avoided. So our approach to this entire, pandemic itself should be very, very different. And that's the realm where we definitely need to actually go ahead and get prepared for. What are those things that we can actually go ahead and look at preparing? Are there enough investments in health infrastructure that's actually going ahead and happening in the country today? That's something that is very, very important, and we understand, from the pandemic itself as to, is it universally distributed across the country? Private sector to a very, very large extent is resident out of the large cities. So is there an ability through, certain incentives and SOPs, etc., that will enable, the private sector play a very, very important, private healthcare sector play an important role in actually going ahead and looking at healthcare that is good quality healthcare that is spread across, the country. We've had great opportunities to actually look at significant collaboration in the form of private-public partnerships in this pandemic itself, where many hospitals in the public sector were refurbished and got up to speed to treat COVID patients. So is there a permanency in each of this? Because during exigencies, during emergencies, it's always easy for us to go ahead and put our best foot forward. But on a day-to-day basis, if there is a conscious, effort to actually go ahead and build, health infrastructure across the country, it will definitely go ahead and help. Because, as I told you earlier, sometimes pandemics cannot be, completely prevented. But our approach, if treatment actually starts early, if we do have infrastructure to be able to go ahead and accommodate a large number of patients, the natural in a pandemic that the numbers will surge, it will be very easy to go ahead and keep it under control and not let it take on significant proportions. The second, obviously, is our approach to universal health coverage. And that's another area, because pandemics are something which catches, the most intelligent people by surprise. So it can really put people back in terms of their, ability to actually go ahead and afford. It could be life savings. It could be something significant that they've kept for some other momentous occasions in their lives that actually gets, translated into payment for, treatment during a pandemic. So it's very, very important that we address the affordability part of it also to the large cross-section of the population. One is probably like what the government had come back with, subsidized, significantly subsidized care. But each time a pandemic happens, it's going to really erode the economic value creation of the country. And therefore, it's actually important that we are able to go ahead and create the affordability parameter much in advance so that, industry, economy is not significantly economically burdened by pandemics. So therefore, that's the affordability part of it is again something that is very important. So basically, if prediction, prevention, health technology, infrastructure creation, and affordability probably would be the way I would actually go ahead and look at saying how can this, future pandemics be kept at bay. Obviously, it's akin to a military situation, and look at how countries have actually responded to any threat from the border or any threat from any other country. They tend to actually have a lot of intelligence. They tend to have a lot of preparedness, which actually significantly enhances their ability to actually go ahead and look at warding off challenges. And I think it's that same method that we need to actually follow during pandemics as well. And if we are very, very clear that pandemics are some things that would continue to happen, we will need to be prepared as to how we can keep these, significantly under control. So that's something that's going to be very important. Health technology of the future is going to be very, very important. So the National Digital Health Mission, where almost all the medical records of the citizens of the country are going to be digitized, is again a very, very important framework in trying to go ahead and look at this whole preparation around pandemics. Because if the medical fraternity has passed information around people, and at the click of a button, it's so much more easier to go ahead and look at treating people early. And this is not only for pandemics, but also during a normal situation, because outside of the pandemic, there are non-communicable diseases, chronic diseases that are also going ahead and getting into very, very large proportions. And therefore, health technology, health information that's actually going to be easily, transferable, the modular part of health technology, going to be very important if we need to go ahead and look at our, country over the next so many years as something that's actually going to be, healthy. And obviously, we would, probably look at summarizing this by saying that what happened during the pandemic was a significantly healthy collaboration that happened between several, service providers, and therefore new models were experimented with. Suddenly, what was not supposed to be a socially distanced industry, what was supposed to be a very touch and feel industry, suddenly turned, virtual. So unless a whole lot of people, they had they not actually come in and collaborated, maybe we would not been able to go ahead and put this kind of a digital front end. Because for most healthcare providers, for most hospitals, they did have a very, very staggered way to go ahead and look at, adopting digital transformation. Maybe over, the next 3-4 years, 5 years, they would have actually got themselves reasonably digitally transformed. The pandemic has actually gone ahead and, completely changed all the thinking. And it's come in that, the last year, where significantly large number of digital initiatives were actually carried out. Healthcare was not something that, and that too, serious healthcare was supposed to be rendered at home. Consultations became virtual, and at one point in time, most large hospital chains had about 75-80% of their consultations completely virtual. Home monitoring systems that actually, came in. The entire, RT-PCR testing technology also underwent significant technology changes. Production of PPE kits, I mean, we wouldn't have been a self-sufficient country until and unless technology had actually gone ahead and taken over. So technology, I guess, is going to drive the next phase of healthcare. While saying that the connect should still be human, the connect should still be, in boundaries where people can actually go ahead and, appreciate. And maybe with all this, we'd probably be able to go ahead and look at our preparedness to be significantly better in the coming days. The next part of it, obviously, is the Gen Z. And those are the people who have been born after 1997, and to whom, Facebook seems archaic. email seem, of a completely different era, may not be even their grandfathers, but maybe their great grandfathers. How do we actually go ahead and look at, health adoption in this, generation that has significantly, changed the way they approach healthcare? And for me, and I think the entire example that I would like to go ahead and draw is from automobiles. We talk about generation changes in cars, where a third generation car with the same brand name does not look similar to a sixth generation car. It's completely different. That is how human generations also change from the Gen Y to the Gen Z and probably even beyond. So I think it's very, very important that this is a wired generation. This is a technology-driven generation. But I think the human connect when it comes to healthcare is very, very important. We've actually had many occasions where we've actually sat with youth, spoken to them, found out about their inhibitions to actually go ahead and look at service providers like hospitals, etc. And their first retort has always been that, guys, I mean, we don't need parents, we don't need professors. We need a friend who can actually go ahead and, understand our health issues, understand our ability to actually go ahead and communicate freely. And that is, I think, where hospitals and service providers, healthcare service providers, need to graduate, significantly, is in understanding this generation, completely. What are their aspirations? What is the ambience in which they will actually go ahead and absorb health news? How do we actually go ahead and have a conversation with them? How do we actually get them to go ahead and open up? These are all significantly important criteria before we overlay technology or before we overlay anything that is a medium. It's at best a distribution point. It's a human emotion connect that is very, very critical. Young girls, they have a number of issues. I mean, they want to discuss about PCOD. They want to discuss about their monthly cycles. But the ability for them to open up will be dependent on how clinicians actually go ahead and react to this generation. They can't probably look at a consultation parameter that looks at one size fits all. Like marketing, like any other industry, it is a target segment that will have to be dealt with very, very differently. And I think that is the first realization that healthcare providers will need to go ahead and look. A lot of work happening, a lot of healthcare brands, keen that this category of youth, this Gen Z, react to or approach healthcare brands in a very, very positive way. Now, brand loyalties, stickiness, these are all maybe things that, the Gen Z may not look at very, very clearly. They will go to where they feel they are being recognized. They will go to feel where they think they're able to go ahead and express themselves. And that's the first change. Now, technology at the end, I mean, will be a leveler, and it will be a medium in which we'll be able to go ahead and pass information to the youth. So I think when you actually go ahead and deal with Gen Z, it's a hybrid between technology as a medium that they understand really well, to the emotion connect that they're able to go ahead and look at, as far as a brand is concerned. That I think will be, we as healthcare providers be able to go ahead and instill the right kind of health consciousness in this Generation Z that we call, as they approach, their teens and beyond. There are health problems that start in pretty much early, and therefore the health counseling, the health intervention, it's like insurance. The earlier you start to actually go ahead and look at insurance plans, the better you are when you're older. It's the same approach to healthcare as well. The earlier that we actually go ahead and invest in our health and take it seriously, the easier it will be. Just imagine that the Gen Z will actually grow on to be the economic value creators in future. If you can actually go ahead and keep this generation healthy, if you can keep this generation free of diseases, etc., absenteeism, everything can actually significantly come down. And look at what it does to the country. that becomes a significantly productive generation, creating so much of economic value for the country. The emotional loss of actually seeing somebody sick at an early age, all that is actually going to go ahead and get transformed. There are many players that are coming in to actually who are going to go ahead and look at predictive analytics, who are going to go ahead and look at artificial intelligence, having the ability to actually predict, disease progressions, etc. And I just hope the youth of today start to go ahead and look at the preventive healthcare culture as something that is very, very critical for them, because nobody likes to be unhealthy. Nobody likes to actually, have an ailment which significantly pushes them, back many years. So with the advent of, technologies that significantly look at predicting diseases, we probably will be able to go ahead and get a population that is so much more healthier, so much more aware, so much more conscious about what they need to actually go ahead and do. And that, I think, is important. So to probably look at summarizing this whole thing, let's not get out of the human connect because technology is available, because technology in isolation may not be able to achieve too much. So it's a hybrid model that will work with this generation. The endeavor should significantly be to understand this generation, their ability to go ahead and absorb, health news in a manner, in a medium that they're able to go ahead and understand. Maybe a lot of elaboration around disease, etc., may be lost on this generation. Short news, like how it comes in various forms that we look at digitization today, should be content that they would be able to absorb fairly easily. From the clinician's point of view, they will need to understand this target segment and what drives them. So, probably if they need to be trained, if they need to be told, if they need to actually do focus groups with some of these, Gen Z kids to actually go ahead and understand what, moves them towards healthcare brands. I think that should be done because, healthcare today is in a very, very different era. As I told you, from a lack of social distance and a complete touch and feel, it's moving towards an era where, a large part of the health consuming public would look at healthcare at their doorstep more than they going to be doorstep of the hospitals. And so therefore, there is a lot of work to be done in understanding this generation. Hybrid of the emotion connect and along with good digital technology, I think will be the way to go ahead and address this group for a healthier India.
Thank you, Mr. Rajgopal. Now, friends, healthcare and medical education have no immunity to universal, rapidly changing technology. Instead, technology can improve medical skills and education. In medical education, advances like simulation, virtual patients, and e-learning have evolved as pedagogical strategies to facilitate an active, learner-centered teaching approach. To speak more on this, we have with us here today Dr. Pawan Indralal, Executive Director and CEO, National Board of Examinations in Medical Sciences.
So good morning, ladies and gentlemen, and dear delegates participating in this PCQuest HealthTech event this morning. It's a great privilege to be a part of this meeting, and on behalf of the National Board of Examinations in Medical Sciences, I bring greetings to all of you. The National Board of Examinations is a body, autonomous body of the Ministry of Health and Family Welfare, Government of India, and its prime mandate is to conduct very important entrance examinations such as the NEET postgraduate examination, which is called as the NEET PG, NEET super specialty examination for the postdoctoral courses, and various other licensing examinations such as the foreign medical graduates examinations for both medical doctors as well as the dental doctors who are qualifying from outside of India. Apart from this, another important mandate of the National Board of Examinations is to conduct training within India in institutions which are outside the medical colleges. So all such institutions, both in the government and in the private sector, which are outside the framework of a medical college setup, where principally the National Medical Commission rules and guidelines are applicable. In all these institutions, we are the body where we accredit the hospitals for conduct of postgraduate and postdoctoral training, and then conduct the examinations for their entry, supervise the training of the doctors during that period of 3 years or 6 years, as the case may be, for various types of courses that they are getting into. And at the end of that particular training, conduct exit level examinations also. So as you can see, largely we are an exam conducting body, and therefore it is very natural that we would need the help of technology to improve the way we deliver our examinations and the way we ensure that quality, fairness, and objectivity remains the prime focus of our organization. It is for this reason, and it is for this credibility, that the Government of India has entrusted very, very high stakes examinations to our body. And I'm very, very glad to share with you that we have been able to use our technology partners in such a manner that the level of reliability of the exam and the level of objectivity of the exam remains at the highest level, and all those processes are effected which ensure that the correct examination is delivered. At the same time, any fraudulent means for leakage of question papers or for other ways in which the same can be tampered with is completely eradicated. Most of our examinations nowadays are held in the computer-based format. That means the candidates are located in the front of a console, and they have to visit the exam centers which are given to them. And obviously, technology partners are required for us to ensure that high quality exams get delivered at these centers. So we have a very sophisticated system of encryption of the question papers. Multiple encryptions are there at our level and again at the level of the various partners that engage with us. And nobody is able to know that what question is being delivered to the candidate till the time it is released in a very, very sophisticated manner, with several password protections and several encryptions and decryptions, that the exam paper is delivered to the particular console. Just like you are seeing me here in front of you, the question paper comes in front of the candidate, and then they are able to execute the exam in the time provided. So the issues that we currently have are in ensuring that we have the right candidate appearing for that particular roll number. So it should not be a fraudulent candidate. And we have seen that there are many types of frauds that are attempted by various people who have different motives. And it is our duty as exam conducting body to ensure that such motives are not becoming successful. So we use biometric capturing at the exam centers. We use Face ID now, and obviously the physical document identity verification is also done. What we have recently introduced in the last 1 year is also during examinations, we are doing the face identification, so that in case a candidate swaps or attempts to swap a seat after taking a bio break, then it is prevented and we come to know about it. So you can see that the level of participation of technology is at a very high level. We really are looking for innovations, and we regularly engage with our technology partners to ensure that the level of perfection and level of difficulty of any attempt being made to break our barriers is always improved, and always we are keeping a step ahead of the others who are trying to break these barriers. So the same security measures are also instituted by us when we are issuing pass certificates to our candidates. So in those cases, we need to ensure that it is the right candidate, and those are done in a physical format. And once again, Face ID biometric capture is taken at the time of the release or handing over of the pass certificates, and is compared with their data that was collected at the time of their examination. And even in the last 1.5 years, we have been able to catch people who were trying to break all these barriers, and successfully we were able to utilize technology to the best possible way, such that we could improve this gap and make sure that it's 100% reliable examination. The other places where we are looking forward to innovation is in the way in which we make our question bank. At the moment, the question banks are received from the examiners through encrypted mechanisms on password protected CDs, or even item writing workshops are held in the organization. And then the questions are they are validated by several rounds of processes, and the final product gets ready. It is at this level also that we engage with our technology partners to ensure that we are getting a very good quality product, which is able to be friendly to the examiners who come to modify those questions, as well as it is safe for us to ensure that the process has been completed in a proper manner. The newer initiatives where we have engaged in the last 1 year is in e-logbook, that is electronic logbook. Because doctors are working in hospital setting, they are working on data generated on their patients. And classically, they have been making logbooks of their patients in a physical format, writing it down. Nowadays, with the use of smartphones, either Android or Apple-based, we have now been able to get into a platform which is able to give the access of this electronic logbook to the candidate, and the candidate is always under a supervisor. So there is a dedicated username and password and a login for the candidate, and there is a separate one for his own student, for the teacher. And this is another thing where technology needs to be brought in and modified and upgraded at a regular interval and regular pace. We have also engaged our students in writing thesis work, and this is another area. We have created a thesis repository which is electronic now, and the whole idea is that research and innovation can be collated into an electronic library of thesis, and it can generate high quality publication which is bringing knowledge to the medical journals at the highest possible level, and gets recognized and gets incorporated as an advancement in science and technology for application for the betterment of patient care. Lastly, it's a very important function that we added during the COVID. Using this pandemic as an opportunity, we started educating our students, which are present in the entire country in both smaller and larger cities, through conduct of webinars. And that is another place where technology is required to access these examinations, to access these students, and make sure that the information goes to them. And along with this, we were able to do a centralized conduct of examination, what we called as objective structured clinical examination, which was run from the national board, and at the same time, the question was being given to the practical centers where the candidates were seated, and they were able to get this question and they were able to answer it at the same time. That was another innovation that we did. Now, because medical sciences are hands-on sciences, they need assessment of hands-on skills. The newer innovations that are required from the technology partners is to take hands-on training through the digital mode and ensure that this hands-on training can be given across this medium through which I am communicating with you today. So this is an important innovation. We have already started baby steps into it. In fact, I have personally started this as a project for surgical simulation and training. And I'm sure this is just the start, but we can ensure that this hands-on training, which means that when I am doing it here, the person who is receiving it does not only see and hear it, but actually does it. And I am also able to see what he or she is doing. So it's actual mentoring for the students. I think that is the highest level of digitization and skill enhancement that can happen through this media. So once again, I would like to thank the organizing committee of the PCQuest conference on healthcare technology for this very kind invitation. And we look forward to engaging with technology partners in transforming healthcare and transforming examination delivery and examination conduct in this country today. Thank you very much for this patient hearing.
Thank you, Dr. Lal. A little effort today can have big results tomorrow. That's why personalized preventive medicine is the healthcare of the future. Digital technologies have immense potential to power personalized preventive healthcare. But how? To enlighten us on the shape of preventive care tomorrow, we have with us today Mr. Jay Srinivasan, founder and CEO, RedMed Health Systems.
Hello, I'm Jay Srinivasan, an entrepreneur and founder of RedMed Health Systems based in Bangalore. RedMed enables affordable preventive care for early detection of chronic disease and hopes to do so by extending care by design beyond its traditional confines. Imagine this for a moment. We are in late 2022 and the COVID pandemic has been beaten back comprehensively. What do each of us seek from the healthcare of the future that is attractive to our needs, even before we need it? I expect this will be some version of being healthy, not being diseased, or not being hospitalized. That is, in fact, a tall order and calls for the kind of preventive care we need in the future. Luckily for all of us, there is now a virtuous alignment of many stars: need, awareness, disease context, political momentum, and technology. All we require is design for execution. Every transformation has a genesis in some singular event, and preventive care, as we know it today, is no different. So what is the future state in the light of history? Much of the stream of industrial innovations we have hitherto observed, been affected by, taken apart in, consumed, and taken for granted through much of the 20th century and continuing to the present day, had its origins in the onset and during World War II, when the US government embarked on rapid emergency wartime requisitioning of extraordinary funding for research, and together with it, the assembly of extraordinary minds in diverse areas from mathematics and statistics to natural sciences to engineering to managing complex systems. They were put to task to solve complex and barely understood problems confronting war: weapon systems, communication systems, security and encryption systems, navigation systems, vehicle systems, chemicals, biology, material science, you name it. These activities happen in all parts of the world, but were brought in great focus and the results available and exploited as industrial innovations for decades after the close of the war in the United States, and as spillovers eventually in the rest of the world. We live daily the benefits that accrued from these disparate and diverse activities that were accumulated in those initial years and arising out of an emergency. Healthcare from 2021 onward will be no different, thanks to the ongoing pandemic, our singular contemporary event that focuses minds, energies, funding, and long-lasting innovations. It has brought particular and acute focus, again thanks to an emergency, to issues like availability, accessibility, affordability, assurability, and auditability in the conduct, efficiency, and delivery of healthcare to large masses of people. The talk today is of vaccines specifically to slow and end the rampaging virus, but it could well be of healthcare in general and prevention in particular tomorrow. The pandemic is that singular event that presages an impending transformation. The classic pyramid of care. In medicine, a classic description is of a pyramid: preventive or primary care at the base, secondary care in the middle, and tertiary care at the apex. It shows graphically how human beings transition through the stages of early, low complexity medical issues to very complex ones requiring hospitalization and the intervention of specialists. A majority of health issues lies at the base, affecting the largest segment in a population. In everyday problems and niggling issues like cold, fever, aches, and pains, they are the easiest to solve for least cost. But the reality of how we approach health care all across the world is muddled in this very description of transition. Most healthcare systems at the base are basically stationary, while activity gets loaded onto the top. In both cases, healthcare as a system is passive, and the consumer is an equally passive participant in his or her care. We were witness to this in a dramatic way last year when the COVID-19 virus that called for vaccines at large quickly overwhelmed the system at the tertiary end, when complexities arising from age, comorbidities, and rapidity of organ failures collided with an inability by hospitals to cope with surging admissions, inadequate oxygen concentrators, ventilators, and drug shortages to treat respiratory disease. Where does preventive care miss the bus? Let's take an example. An adult in his 50s visits a doctor, a general practitioner, complaining of some problem. The doctor treats for the symptom, an episodic visit that may go well or may not. Individual returns home. Days or weeks or months later, the person is hospitalized for a heart attack. Further tests show blocked arteries and procedure initiated. What we have is one of the possibly many episodic preventive care visits that did not discover underlying major issues and resulted in a later acute care hospitalization, entailing much aggravation, trauma, and expense. As we all know, this is not unique. Could this have been avoided? Yes, but only if the healthcare systems are designed and adapted for a much more sophisticated and proactive preventive care delivery. It entails recognition of the critical difference between acute and chronic diseases and how the latter could be made reversible through early detection and acute hospitalization minimized to a great extent. The pandemic, of course, is an extraordinary once-in-a-lifetime occurrence, but the healthcare systems have always operated within the same exigencies in simultaneous small segments, not whole populations, as with the pandemic. We call them acute illnesses and chronic diseases. And they work in pretty much the same way as we observed with the virus, something not tackled in preventive care that explodes in an acute care setting. The numbers are more gradual, but the end results are the same. Global burden of disease. The WHO estimates that 50% of the global burden of disease today owes to chronic diseases. Chronic diseases differ significantly from acute illnesses. They are often lifelong, slow in gestation, and reversible when detected early. The complexity increases with comorbidities when more than one chronic disease exists simultaneously. The good news is that they can be treated and reversed when the individual participates in a system that calls for active participation of consumer, clinicians, and non-clinicians alike, and health indicators are monitored often, risk identified and stratified, use of predictive measures, and in providing proactive care. All this calls for a complete revamp of how healthcare systems are structured and care services delivered. The required overhaul, therefore, would start with increasing funding for preventive health by an order of magnitude, while recognizing that there is a possibly fine balance in funding between acute and preventive health. It also calls for placing the consumer of health at the center of a symphony of players that includes stakeholders in the healthcare fraternity, professionals, providers, insurers, drug and device manufacturers, pharmacies, and those outside, such as employers, policymakers, government, etc. Finally, it equips the system with a panoply of tools to make delivery of preventive care seamless across time and space in the form of adequate staff, process and methods, standards, and technologies that could be brought to bear to address the issues. Transforming preventive care. Such a transformational preventive care has to be designed from the ground up, but it can be hastened through learnings from other industries and absorbing where and how innovations happened. Industries such as automotive, defense, financial, telecom, retail, logistics, technology, etc., contain a lot of embedded knowledge in the form of standards, processes, and systems, vendor accreditations, recruitment, training, etc. The military standard in the US, MilSpec, for example, are defense standards that go back to the Civil War and has been responsible for everything from height of tables to sampling and testing of circuits that have shaped and influenced product development in civilian life. In more recent times, the technology sector has demonstrated the value of open architectures, interoperability, plug-and-play schemas for third-party services, identity verification, and security. Transformation requires recognition of and addressing issues relating to the several cogs in the wheel. So future preventive healthcare, at a minimum, must include making complex administration viable through decentralization of ownership and accountability to perhaps the PIN code level. In technology parlance, this would be called distributed architecture. Ensuring mandatory citizen screening and monitoring of basic vitals parameters. Giving consumers choice in the matter of care and to offer their current provider as default. Transparency in pricing by means of rate cards, and preferably have any subsidies credited directly to the bank account as under DBT. A level playing field for player-neutral provision of services relating to care by the public and private sector alike. Vendor accreditation and empanelment that enables interoperable plug-and-play services to be offered that fosters competition and low cost, such as, for example, through the implementation of fast healthcare interoperability resources, FHIR or FHIR. Security, transparency, and traceability through the implementation of blockchain, incentivization and disincentivization of all players, including consumers of health, through appropriate behavioral psychology constructs and models that preclude gaming and directs behavior in desired ways. Efficient data structures and data science that enable collection of appropriate data that could be captured as useful real-time insights with the use of algorithms, machine learning, predictive analytics, and heat maps showing real-time trends and specific clinical variables of interest within the demographics and geographical areas for appropriate action. Care that adapts to the 4 Ps: preventive, personalized, participatory, and predictive, and intervenes proactively before an issue of health gets to become acute. Many of the pieces are already here today in dribs and drabs. Advanced sensors making continuous and home care possible, high bandwidth and connectivity for our connected devices, remote access to doctors and other healthcare professionals, easy monitoring of data, and real-time risk computation. The larger complexity lies in intent, cultural change in terms of administration, and focus on outcomes, economics, and behavioral change. In a manner harking back to World War II, this preventive care of the future would be the outcome of innovations coming from all quarters in incentivizing consumers and providers alike to collaborate and participate in active discovery of potential risk, progress towards distributed care models, novel methods to attract investors to share in the upside from positive outcome measures, and a very disciplined and razor-sharp focus on clinical outcomes. Thank you.
Thank you, Mr. Srinivasan, for that informative and useful talk. Technologies which were earlier only meant for enterprises now have found their relevance and wide usage in the healthcare sector. In the past decade, we saw technology pervade healthcare to initiate services like telemedicine, e-pharmacy, personal health management, home healthcare, and others. But both providers and consumers were slow to adopt these services. Things, however, changed drastically when the pandemic hit us. It caused seismic shifts in healthcare delivery and consumption by pushing providers and consumers over the tipping point into widespread adoption of these services. To discuss the disruption in the Indian healthcare system post-COVID, we have with us today Mr. Dheeraj Jain, founder, Redcliffe Life Diagnostics, Mr. J.P. Dwivedi, CIO, Rajiv Gandhi Cancer Institute, and Mr. Gautam Chopra, CEO and co-founder, BeatO. The panel discussion will be moderated by Sunil Rajguru, editor, PCQuest and CIOL.
So good afternoon, everyone, and welcome to this latest session in the PCQ HealthTech event. Today's forum is titled Disruption in the Indian Healthcare System Post-COVID. Now, I think all of us are familiar with the way COVID unfolded. It was a great disruption of our life. It was a great disruption in our way of living. And while the COVID disrupted the healthcare system, one thing which came to the rescue was technology. Technology gave us a lot of solutions, but that itself proved to be another disruptor. So I think we will, discuss this disruption in health tech technology. So I think I'll start with you, Mr. Dwivedi. So I'll ask my first question to you. So, telemedicine has been around for quite a long time, but there has been a great reluctance to adopt it from the people, from the doctors, and even from the government regulation point of view. But that is one thing which is finally taking off. And of course, there was an inhibitor in terms of technology. Today, you have the collaboration tools, you have the bandwidth capacity, and more importantly, even in rural areas, everyone has smartphones, the apps are coming up. And finally, there's also a big issue of digital records. So, I mean, when you talk of telemedicine, it encompasses so many issues. So maybe if you could speak a bit about this.
Sure. First of all, thank you so much for inviting me to this panel. And it is a delight to be with all of you and share my views with you. You are absolutely right. People have been trying telemedicine for more than a decade. And for so many reasons, and most prominent ones related to either infrastructure or regulatory issues. I mean, whether those prescriptions are really acceptable in the court of law, and whether the telecommunication lines are dependable enough, reliable enough. So all these were problems. But when this pandemic came, I really very fondly narrate one couplet of Bashir Badr Saab to everyone. That was written a few decades ago. जो गले मिलोगे तपाक से कोई हाथ भी न मिलाएगा ये नए मिजाज का शहर है जरा फासले से मिला करो. So that came so apt. People were loving distance, and that is how telemedicine kicked off now. So people are consulting doctors from home, and doctors are not very unhappy about the crowd being reduced from their OPDs, and they still being able to contact their patients and talk to them, and non-essential consultations can happen. There are so many aspects of it. Number one is, managing their busy schedule. Why telemedicine was not kicking off? Doctors are busy seeing the patients who are present in person. Now having one integrated schedule is very important. So that was missing. A lot of manual coordination was being there. And one single schedule helps. One single waiting list, that maybe 20 patients are waiting in person and 15 persons are waiting on teleconsult schedule. And they are all seamlessly intermingled. Now, with integrated apps, everything being stored in cloud, all documents available online for reference. That is very much a reality. The other is that island applications, provided by different specific telemedicine providers, and everything being stored on their own cloud, on their own separate island of the data structures. It does not help integrating with the single longitudinal patient record. So that was also the problem. Now with the integration, everything becomes part of a single database, single monolithic system. And in spite of that, still being available to the patients on their PHR, on their mobiles. So that is helping. Patients are able to see their medical records, their reports, their everything, even their bills and visit records. And doctors are able to see everything in a single system, including all the reports and images and previous histories and everything. So it all came together. Whole ecosystem was built in such a way that now doctors are preferring telemedicine. You just touched upon the electronic health record. That was another sore point. Vanilla EMR systems making doctor to make 20-30 clicks in order to enter one single patient record. It will frustrate any reasonable person. So the companies came with solutions with content-rich and context-sensitive EMRs, where only 2 or 3 or 4 clicks can really put up the entire prescription together and can help doctor putting the notes. Certain devices, voice recognition, handwriting recognition coming to the rescue, and doctors not being asked to put up too much of effort creating an EMR, rather doing their business almost as usual and EMR being created. The third thing that helped is that doctors, some of them or many of them got afraid of touching papers, because paper is one big carrier of the viruses and bacteria. So EMR adoption became easy. So in a way, it is a dangerous, deadly thing. But for CIOs, this pandemic actually has been a big brother.
Thank you for that, Mr. Dwivedi. I like that fastle se mila karo. That has been the story of 2020 and 2021. So I hope ye duriya kam ho jaye in 2022 and we can get back to normal. So, I'd like to now move on to Gautam. That is, Mr. Dwivedi has given it from the point of view of hospitals and telemedicine and records. Now, one thing is the startup industry. Startup industry is usually the youngest and the fastest to react to, such changes. And it comes out with the latest cutting edge technology. So I'd like to know, how has the startup industry reacted to this disruption? And what have been the major trends in the health tech startups? And also mainly, what can we look forward to in the years to come?
Yeah, no, first of all, thanks for that question, Sunil. I think it's a pleasure, to be among such luminaries and having a chat on this important topic with all of you. So like Dwivedi ji, I'm also an eternal optimist. I try to find the positives in every situation. And while COVID unfortunately played havoc, there are a few things that came out of it which make us even more stronger. So for me, when I look at, the last year and a half, Sunil, or more, there were three or four fundamental shifts that have taken place. And especially when you're looking at, tech startups and this new age companies trying to innovate, I think the first and most important thing was on the patient side, as well as, of course, the provider side, but largely to do with the patient side, where, we found three big shifts. One was the overall adoption. I mean, given the fact that, people weren't able to go to the doctors, people had to remote monitor their conditions at home. What was earlier difficult in terms of breaking that barrier of trust on digital solutions became much easier, from the patient adoption side. So that was one fundamental shift. The second, a part of that was also that, earlier digital solutions had a problem in terms of एक बार patient आ गया, but उसके बाद, engagement used to fall next to nil. What we found, and this is a sustaining fact, that people continue to engage with digital platforms. more than so the retention has increased in terms of the time that they're spending, understanding about their health on various different platforms is a lot higher than what it was before. And the third critical thing that happened, in my view, was the fact that this also provided time for digital solutions to be able to demonstrate that they could make an impact on health outcomes, right? So even providers like us or many other solutions in different therapeutic areas, we were actually able to demonstrate that, digital solutions, when complemented with, of course, a more of a physical approach, but let's say more reliance now having to come on in terms of digital solutions, the health impact could be driven through digital solutions as well, which added or contributed to this fact of loyalty by patients becoming more in digital solutions, and therefore driving higher adoption as well as engagement. So this virtuous cycle, or it provided us this time to be able to create a virtuous cycle of trust, both from a patient side as well as Mr. Devedi was talking about, from the provider or doctor side. More reliance on digital platforms has started to come. So that's one fundamental shift we've seen from patient adoption, engagement, and provision of health outcomes in their lives. The second thing which has happened is, of course, the regulatory framework has become more relaxed. So, before COVID, there was always a debate on teleconsultation, online pharmacies, etc., etc. But I think during this phase, we really realized that we can't just have, dependence on physical models. We do need to have more robust regulatory, frameworks around digital health solutions, so that they can also come into the mainstream. So they're no longer ancillary. The need has become imminent for them to become mainstream. So that is second, I think, the push from the government, the NDHM and so many other initiatives that the government is taking up, coming out with, helped us to be able to formalize what otherwise was, keeping digital solutions away from the mainstream healthcare industry. The third thing for us was all this also had a positive impact, Sunil, in terms of attracting institutional capital into the health tech space. And now, if you look at health tech as well as insurtech, which are dependent on health improvements, you see a flood of capital flowing in, which allows entrepreneurs or young age innovators to be able to take that leap of faith, knowing that there is a market which is evolving, but also there is infrastructure support for me to be able to try out new things and raise a lot more capital, whether this is at seed stage or even at a at a more mature growth stage. So I think it's a culmination of these three factors that allowed the overall impetus into digital solutions, which was coming, but the pace of it just got accelerated over the last year and a half, potentially because of COVID. And what is encouraging for us is that a lot of that is still intact. So even now, when the markets are open, people are out there. Hopefully, I read in the papers today that people are top doctors are saying that maybe the third wave we will be able to escape it in some way. But I think that trend, while it may not be at its peak the way it was during the thick of COVID, it is still there and will continue to sustain, in my view, which is really important for breeding more innovation, beyond just what happened during the phase of COVID, because that's the only way we'll get to reach to 95% of India that lives beyond the top tier cities of Delhi, Mumbai, Bangalore, etc., where bulk of the impact has to be created through digital health solutions, combined, of course, with the great work that Devedi ji and a host of other people are doing.
Anyway, thanks, Gautam. I liked what you said, like that 95%, because I mean, the idea is the healthcare has to reach ultimately 100%.
It has to be inclusive, right? So.
Yeah. And Diviji, they also said that there has been a change of attitudes. You have also talked of a change in capital flow. So anyway, let's hope we can move forward on that count. Now, Dheeraj, so this was from the point of view of telemedicine, hospitals and startups. So I'd like to ask you about the diagnostics and testing scene. I mean, not many people talk about it, but that is the most important thing, because that is where it all begins. Before you go to a hospital or a treatment, you have to do that. So I would like to know in this, what are all the upgrades and innovations that took place during this pandemic, and what more breakthroughs can we expect in the future?
Right. So no, thank you for making me part of the panel. And rightly you said, I think the diagnostic is not the most fanciest thing, but I think is the most integral part of the healthcare. And I think what we have found in the COVID, obviously, then everybody pretty much have, either their family or their loved ones have actually gone through a RT-PCR testing and doing that testing at home. So I think the most fundamental change we have seen is that the diagnostic has now moved from the collection center, going and queuing up in the clinic and giving the blood sample, but actually doing it at home. And I think that's sort of a massive mind shift, which I think nobody would have imagined would have happened. And I think everybody have tasted that now you could actually, not only from a preventive body check packages, you can actually start doing your reactive or prescribed diagnostic at home. And I think at Reclave, I think we have taken that very seriously just prior to the COVID, but then the COVID actually, I think whatever we would have seen 5-6 years down the line have happened now. And therefore the industry is quite also changing, saying what are the tools and technology required for me to start managing 1,000 phlebotomists in NCR. So what Zomato and Swiggy were doing for the food delivery, I think this is what Redcliffe is doing for the diagnostic, saying you stay at home, tell us your prescription, we'll collect the sample, we have a lab in that city, and we'll give you the results in 1 hour time. And the ability for us to then start engaging, looking from a lifetime value perspective, commercially saying, if I've actually tested for you this, I would also like to test you for other things as well going forward. But also I like to discuss with you various preventive thing, wellness, allergies, vitamin, pretty much everything. And I think what we are trying to make is a larger awareness on the preventive side, saying not only when you discover the disease and do a test, even before that, you can do lots of different things. And Reclave, with our product portfolio of genetic and genomic testing all the way then to basic routine, I think that sort of helps. So that is from a consumer perspective. But what is also happening largely from, I think pathology is changing. So we talk about general transferring of imaging of histopathology online and then getting reviewed by pathologists remotely or by actually having an expert pathologist wherever he's sitting, getting that consultation happening online. Obviously, that's something very, very different. Complete automation, like from what's happening in the lab, is obviously complete automation of track and bidirectional barcoded, running all the samples, then use of a lot of AI, which can start reviewing and suggesting more precise evaluation done by pathologists. Earlier was kind of more generalized. So I think generally the more and more data you're collecting, feeding into the AI ML platform and then coming back with something more precision-based medical diagnostic. And then specifically that, understanding that specific profile of that consumer actually, and then finding that out and giving, obviously the more prescribed or more precise view on the test. I think that's something is completely different. And then this is what we're sort of seeing in the last 2-3 years happening. But for us also from a capital perspective, as clearly Gautam mentioned, I think healthcare have never seen that kind of capital flowing in. And I think most of the large investors are actually now seeing, they're seeing education, fintech. But what in the health tech, what are these companies who have genuinely have actually did something to improve the disease and the health outcome? And what are these industries available? And I think we clearly know that, the consultation, the leaders been identified, pharmacy leaders been identified, diagnostic and OPD treatment is sort of two spaces where no significant disruptions have happened. And that's what I think we are trying to take a little bit of that space, saying, let us disrupt diagnostic in a completely different way, not just doing home collection, but also now we are building the largest network of radiology as well. And clearly the capital is also helping us. I mean, and this is what is saying that, see what has happened to PharmEasy, a lot of consolidation, but still large consumer experience. I think similar thing will happen in diagnostic and, carrying on to understanding and improving the sort of the disease profile of that consumer. So the responsibility for diagnostic companies is actually far beyond than just diagnosing, because that's the consumer which you sort of take on board, and how do you actually work with them to do a lot of preventive thing, but then also kind of provide them various other services.
Thank you, Dheeraj. I like that part about preventive and AI, because I mean, seriously, if you had a new disease and people were, diagnosing themselves, then the AI would automatically be able to tell that there's a pandemic on the way. And I mean, like COVID-19, we were totally caught unawares. So let's hope, I mean, we can, have some sort of predictive thing.
Yeah.
Yeah. So, I asked you about your specialities. I'd like to, throw open one more open question. So, which is the one technology that the government of India should promote to transform our healthcare system, and how? Because, everybody's doing their jobs. Hospitals have been working 24 hours, doctors, nurses, startups have been coming out of the solutions. We usually say, the government should do this, that. So from your point of view, what is that one thing that the government should do and promote in our healthcare system? You can go, anyone can go first.
So I think, as you rightly said, from an AI perspective, I think use of a lot of AI and technology interface, that to allow for speeding up the system and providing, all that remote review of reports and really that fast delivery to the patient and to the clinician. I think a lot of that technology. So kind of really promoting tech, because there will be clearly a shortage of technicians, a shortage of pathologists. And I think especially from remote villages, you can't have a centralized lab and district lab in that particular kind of pretty much in all the other locations as well. So I think kind of building that remote kind of interface and then using tech in the back of it, because, the amount of data we have, and then we come back with the understanding profiling of these people all over the sort of the country. And I think so a lot of tech is what I mean, we believe from a diagnostic perspective, I think government can actually help encouraging the ecosystem.
I would say most important is telemedicine. Government is anyway taking up several initiatives, e-Sanjeevani. We need to have battery of experts backing up this infrastructure, and doctors being available for the consultation, reaching out to remote villages everywhere. At least preliminary care should be available to all at minimum cost, minimum disruption. And the infrastructure build-up that is happening around telecommunication will certainly enable that. The other, that as Dheeraj said, we are now at an inflection point of several very interesting developments. We have been talking about CDSS, clinical decision support systems. Now we are going to talk about PDSS, pathologist decision support system, radiologist decision support system, and then actually confluence of pathology and radiology coming together, all the images being stored in same packs, being analyzed. Probably AI helping the selection of the right test, which gives best value to the patient at that moment, whether biopsy is required or MRI is required or CT is required, which one test is good enough to diagnose the problem accurately and without any more intervention than required.
So, Sunil, in my view, I think the government has to assume a more overarching role to be able to provide the right ecosystem for all of this to function. There's unfortunately no one thing that will solve this whole situation we find ourselves in. I think the biggest role the government has to play is to be able to increase significantly the expense that is dedicated towards healthcare. I think there was a good step made in the last budget, but it's still awaited to see how the execution of that expense is going to get implemented. And I mean, when you compare it to any other country, I think it's abysmal what the expenditure on healthcare is made. And to the point that Devedi and Dheeraj also made, I think for me, by COVID, fortunately, not as significant an impact in some of the other countries, but the floodgates unfortunately were open because the primary healthcare in our country is not equipped necessarily as much as it should be. So when the second lockdown happened, I was part of this movement called Mission Oxygen, and it was heartrending to see that basic infrastructure was completely lacking in smaller cities. I'm not even talking about remote India; these are smaller cities in our country. I think they have, before this, of course, technology will have to be a part of this. Telemedicine will have to be part of it, remote monitoring and everything else. But the government needs to do big things, and we are there to support them in terms of the endeavors and initiatives we all are taking to be able to accomplish that goal of making healthcare more inclusive. But for that, a lot more expense has to be dedicated towards healthcare. And I would think primary healthcare needs to become a core focus for the government to sort out in our country. Otherwise, COVID or similar things are not far away again.
Okay, thank you for those views. So I'd like to ask one thing, if you look at like, say, we need an integration and unification in this industry, like Aadhaar was a unification of the identification process that streamlined everything. The RBI is planning an account aggregator network by which all, lending and borrowing will be centralized. But, that is one thing which has been seriously lacking in this industry for many reasons, because, medical records are in various forms. They are in MRIs, X-rays, paper, and even it's a very sensitive issue. Who owns the record? Does hospital own it? Does the patient own it? But still, it would help if we had a centralized health system. So I just want to know how that is possible, and like from your respective point of views, like whichever industries you are, how do you think this integration can be achieved, and maybe how your industry can get integrated into that?
So very first thing is we talk same language. And by language, I don't mean English or Hindi or Kannada. We should be talking of diseases in the same language. Codification. Have probably SNOMED CT, ICD, or whatever is the standard across the country. The standard for documentation should be set. And then the healthcare provider or even the application software service provider should be allowed to stay only if they are compliant to certain norms. See, HL7 or FHIR standard should be there. And a copy of the health record should be available in the central repository and should be accessed by anyone, just like GSTN. That is how we will proceed. And finance industry has really set the precedents. And they have actually shown the way how to move towards. I think government is already taking steps. We are talking of the Universal Health ID, and DHM has the roadmap. We are talking about the repository or registries of physicians, providers, facilities. So all this will create the ecosystem.
And I'll tell you how, sorry.
No, I was just kind of echoing exactly saying, the scheme which got launched some time back on the NDHM, I think it's a very, very big step. And, that's linking with Aadhaar and then eventually providing that unique digital ID. I think the moment all of that sort of start ramping up and that start eventually becoming a one-stop solution. And as Dr. Dwivedi has just said, having a not only just for ecosystem for doctors or for diagnostic companies or for medtech company, but I think also largely for policymakers as well. And we're looking, both from a modern medicine, preventive medicine, but then also looking all the other interventions of AI, ML. I think all of them start getting assembled together. And I think this is absolutely an amazing initiative. And I think everybody in the industry sort of start getting integrated through that. And there is no other way. I mean, there is no one single private body can actually enforce that. So I think this is a very, very big sort of building block towards that integrated healthcare.
So Sunil, for me, I come from the airline world, and there is this Amadeus and the global distribution system where you can plug in all data and relay it. Unfortunately, nothing like that existed in the healthcare industry, especially in India, because of the incentives of individual players. Private healthcare not really aligned, but I think the government is making the right steps, or taking the right steps. I completely agree with both Mr. Dwivedi and Dheeraj that this interoperability of data is going to be complete. It's going to be the backbone. I'll take the use case of, for example, what we do, and just before the session started, Dwivedi ji and I were talking about it as well. That let's say for a person with who's diabetic and they're using Vito to be able to manage this condition, the evolution of the disease getting poured back into the healthcare provider system. Let's say in Mr. Dwivedi's case, if a patient is on chemo, certain and people have a tendency to have elevated sugar levels. If a provider like Vito could actually get, provide the data on the evolution of this condition of sugar levels to Dwivedi ji for carrying out the right intervention at their side, then the best of both worlds can come together. Because today we are looking at the patient in isolation. He's looking at, or his end is looking, organization is looking at the patient in isolation. Dheeraj is carrying out diagnostics, but there's no, like Dwivedi said, there's no one language that we are all talking at this point in time, and that will give us a tremendous fillip to all these four things that we spoke about in adoption, in engaging the patient more, so that adherence is a key element of any healthcare therapy, but it is compromised today. And finally, either prediction of future conditions or otherwise improving the outcomes of existing conditions that a person has will be successfully done.
Okay, so I think these are all good ideas. Let's hope that the government can implement some of them. Also,
we'll have to play a big role in it. So
that's what I mean. That is all three of you.
Yeah.
So I'd like to hear your views on what is the one big health tech idea is that's going to transform Indian healthcare. Since the theme is transformation, just pick one technology or maybe one big idea that is going to transform Indian healthcare in the 2020s.
So Sunil, I'm biased. It is going to be Vito.
So maybe you can elaborate on that. What exactly?
Yeah. So I think, for me, when I look at it, and this is Vito is of course born from a personal pain point. We've seen diabetes and its complications at close quarters personally. But when I start, and we've been to homes of patients who unfortunately suffer from complications arising out of this condition. The fact that we are having late diagnosis, not only in diabetes, but late diagnosis for most chronic conditions, where we're missing these, windows of either reversal or being able to avoid these complications, is the root cause of where we find ourselves, in terms of, when COVID happens, people unfortunately passing away, not because of COVID, but, comorbidities. So technologies and solutions that allow us to be able to reach the masses, first of all. So it has to be extremely affordable technology. It cannot be something that is, for 1 or 2% of India, because they have access to care anyway. So it has to be extremely cost-effective technology that can get into every household practically, and is able to predict and intervene in real time to give the right information to the individual in terms of the course correction they need, either this be through their prescription or lifestyle adaptation or what have you. But everything needs to be done before then it's getting done today in India, which I believe is the root cause of where we find ourselves. So technology that is cost-effective, getting into as many households, is able to predict, focus for me, of course, on NCDs, because those are going to be the everlasting epidemics, should be the winner for India.
So, Sunil, from my point of view, I would rather like to look at the horizon. What is spreading in the country? Most prevalent cardiac cases. Blood pressure of the country is rising altogether. Second is, we are becoming more sweeter and sweeter. The diabetes is increasing for India as a country. Then cancer, that is also one menace that is really increasing. And in some cases like NCR, the lung problems are increasing. So if you look at all these problems and volume and category of the problems, I think before Dheeraj takes off, I will still say minimum intervention in the diagnostics, minimum expenditure, maximum spreading of the knowledge, awareness. These are certain key areas that we as a country should focus. Let us do health care rather than health repair that we do in the hospitals.
Absolutely amazing. I think very spot on. I think the last line, and I think if we start working towards care and less repair, I think we'll be completely different world. And clearly the amount of lifestyle and the stress, as you rightly said, I mean, all of these diseases could be prevented if we can sort of adjust that lifestyle. And I think that comes to larger awareness. I think the new generation Z, Alpha are very different. I mean, they consume less alcohol, they smoke less. I mean, these are the kind of trend we are seeing. It's a completely different way that how the millennials have come up and how they grew up and what they have been doing. So I think a great opportunity for the younger kind of guys to also drive the larger adoption of on the preventive side of things. And then clearly, as you all said, and I think what we have found that for diagnostic industry as well, it's a bit of shock that the collection center or the patient walk-in center are not anymore the fancy thing to build. It's actually that everything is happening through home. So even Gautam, for you, that device of finding that sugar or various data on that and using that consumable again and again, all of that is shifting. That care is shifting to home, and we think that it's a completely different landscape for at least for the diagnostic industry. And then clearly, as we were talking about the government thing, I think if we can get this consistent EMR, I think that is really the game changer. I mean, India have huge amount of telephone connection, internet connection, mobile. We are the most consuming, biggest in Facebook. Pretty much, I think we have all of that digital adoption. Why not to have these records? And I think these records would have, I think all of us, Dr. Dwivedi, Gautam and us, we can do our job much, much nicely. Obviously providing that amazing experience, but also then kind of think about large technology, which could never come to India. Like I've been promoting genetic testing, genetic sequencing for last 3.5 years. Very expensive, cannot get to a mainstream because awareness is not there. And then also very inconsistent how people understand and how it's sold actually as well. So I think new advanced technology will come once the fundamentals are in place. And I think that's what we would think that to happen. So India is a large, more of an execution rather than innovation. And I think if we can get our execution right all together of us, then I think we're probably in a different India.
So Sunil, if I can just maybe just add to that what Dheeraj said, because I think the core of the problem, and you compare us to the West, the whole outpatient care in India is out of pocket. People pay for it. So nobody is at the healthcare system at the core of it. And, Dwivediji's idea of care before repair is perfect. But unfortunately, our healthcare system is not incentivized to take care of people before they need repair. Unfortunately, most of the monetization actually happens when a person is at the hospital. So that has to be altered. And like we said, the government has to play a significant role in ensuring that, this outpatient care somehow can get paid not by the individual, but by the system somehow. And the healthcare system is incentivized to take care of people, to take Dwivedi's words, and not necessarily just repair people.
So, absolutely. So I think we all need to devise an incentive system towards a healthy society.
Yeah. So, one theme that is coming out is of prevention. And as you said, care, not repair. So I just want to know, like, how prepared are we in the future? Like, when the Spanish flu came, obviously there was no technology. They were totally caught unawares and they couldn't change much. Again, but it is so sad to say we are so technologically advanced and we don't have a shortage of money, but still we were caught unawares. So I'm just wondering, and already this coronavirus, it used to be a cold, then you had SARS, then you had MERS. So it is mutating fast. So I'm just wondering, are we ready for the next pandemic, or will we be caught unawares? And if so, what are the technologies that we can develop to actually, prevent such a pandemic? Because see, if a pandemic is coming, we'll not be able to stop it, but we can definitely check its arrest. So I'd like to hear you on the technologies. Sure, Dheeraj.
Let me take this very quickly, and then I think there's a lot more from my co-panelists. So, we were one of the first one in India to propose to the Health Ministry of doing genetic sequencing of the virus and having that genetic profile, and then keeping a very close eye on the regular to understand the mutant behavior, but then also finding out if there's any even submutants happening in this virus profile in the stack of this SARS-CoV, as you mentioned. I think improving this largely to the whole base of sequencing as much as possible. I think that also from a mainstream perspective, I think it started taking some shape where people realize, sequencing is not something very fancy. It is sort of very, very fundamental. So I think that clearly that infrastructure, I think India have now. It had before, but it even have it at a very different capacity. So we could keep profiling, we could keep finding, all of these. But if we can know a little bit more about it in advance, and clearly, I mean, no virus tells before it's coming, right? I mean, this is complete sort of surprise. Even the new mutants will continue to come. And therefore, I think doing this back-end, the profiling and sequencing, at least from our perspective, that has been very helpful, and that continue to be very helpful even in the other countries. And then obviously, all the other things from a teleconsultation, home diagnostic, all of that continues. We'll sort of react to that later on. Yeah.
Let us look at the positive side. I mean, when have we seen that disease came in the existence or became known to the world in December 2019, and by March the test was available, and within a year vaccine was available to the entire world. It takes decades to build a vaccine. So really we stood up as a universal community, as this world. We actually did a pretty good job if we look at it positively. And now we are talking about having some sort of treatment also. I don't know how far we have succeeded or how soon we are going to. But I agree with Dheeraj. I think the genetic sequencing holds the key.
I resonate with thoughts of both Dheeraj and Deveti. I think we need to keep looking at positives to keep encouraging us and motivating us to, building on the successes. This was no small feat that the world accomplished together, whether it was coming up with the test, vaccines. Look at so many people who've gone through COVID after the vaccines, and there has been practically no symptom, and all of this has been achieved in the last year and a half, right? So I think technologies will continue to evolve to be able to better predict such circumstances so that, early detection and early prevention procedures and protocols can be rolled out. I think we're much smarter. I would look at it from, in the rear view mirror. I think we're all a lot smarter about how to be able to tackle such situations if they were to arise. We're also much smarter going forward to be able to predict such circumstances from not arising, or if they arise, then averting the complications that come with it. Of course, it will have to be also, the onus is on the individual as well to be able to, prevent such things to, really scale up the way they did. You still see people, at least in Delhi, completely taken off their masks and moving around. So I think the basic hygiene protocols will continue to be, the onus has to be on us. And again, all of this boils down to the immune system and lifestyle that all of us will lead. So all the technologies that are coming in, the innovations are coming in to make people healthier, stronger, better, will negate some of this impact that might come in the future as well. So yeah, I think we're all much better prepared and smarter than before.
So I think on that positive note is a good place to end the panel discussion. We can go on forever. So I would like to thank the three of you, because I think in such a short time we have discussed so many ideas, and these are great ideas which are workable. So I guess now we just have to go and implement these ideas. And I'm sure that, Indian healthcare, it was a crisis, but it's going to be a great healthcare system in the 2020s. I'm hopeful, and I'd like thank you, all of you, for giving your ideas and views.
Thank you. It was a pleasure.
Thank
all
you.
the best.
Thank you. Thank you.
Yeah.
I would like to thank all the panelists for such an engrossing discussion. Ladies and gentlemen, welcome to the next session: Artificial Intelligence, Augmented Reality, Virtual Reality, and Robotics in India's Medical Future. We have with us today emerging health tech companies to talk about this. Our panelists for this session are Dr. Zainul Charbiwala, founder and CTO Tricog, Mr. Niranjan Subbarao, co-founder Cyclops MedTech, Mr. Tathagato Rai Dastidar, co-founder and CEO SigTuple, and Dr. Sudhir P. Srivastava, founder and CEO SS Innovations. They will discuss how cutting-edge technologies can transform the Indian healthcare system. The panel discussion will be moderated by Somata, Associate Editor, PCQuest and CIOL.
So technologies that once used to be in the realms of science fiction have now become the reality. Yes, we are talking about technologies like AR, VR, AI, and robotics. We saw how technology adoption took a quantum leap during this pandemic. People moved to digital platforms almost overnight, and companies and industries responded in turn. Did it help the healthcare providers to set aside apprehensions and be more receptive to new technologies? Let's hear it straight from the horse's mouth. Today we have with us Dr. Zainul Chadbiwala, founder and CTO Tricog, Mr. Tathagata Raigustidar, co-founder and CEO Sigtapu, Mr. Niranjan Subbarao, co-founder Cyclops MedTech, and Dr. Sudhir Srivastava, founder and CEO SS Innovation. Gentlemen, the floor is yours now. Could you please tell us a little bit about the ground realities in terms of a newer technology adoption? Dr. Zainul, would you like to go first?
Thank you, Soma ma'am, and pleasure to be part of this session. So it's been about 18 months since we've had this the pandemic, the whole event unleash on us, and it's definitely been an interesting journey. At first, I guess everybody was very confused as to what would happen, how we would react, how the markets would react, how communities would react. But I think the first wave taught us things very quickly, and I think we were prepared very well. At least in the health infrastructure did build up before the second wave came. Yes, we did have a fair bit of an effect in the second wave. It was much worse than we anticipated. But I think the key things about technology is, I think as you said, almost overnight things got adopted. Digital platforms got adopted, got built. The people who were ahead of the game on the digital side definitely did benefit from this. And I think the main aspects of technology that really helped were things like teleconsultation became pretty much the norm, right? Getting a consultation remotely, something that was not accepted earlier, even by healthcare providers, was something that all patients really clamored for, and doctors really adapted and said, look, this is the time we have to change this. And so this is really the main change that happened is the healthcare industry really adopted technologies which they would have taken maybe 5 years to get to. We had it happen in 3 months to 5 months. So there was that real acceleration that happened because of that. I'll let the other panelists also chime in. I'm sure there's very different, diverse views from each perspective as well. Please.
Sure, Mr. Datsika, you would like to start?
Sure. So I agree with Zainul on the accelerated adoption of digital. That has really been a huge change in the last 18 months. But what I do feel is that while we have adopted the connectivity part of digital with open arms, things are yet to get to a long way when it comes to remote healthcare digital in terms of healthcare delivery. It's not just a consultation, not just getting a test report via WhatsApp. There are things to be done in terms of remote healthcare delivery. I think that on that part, we maybe the world as a whole is still lagging behind, and there is a lot of ground we can cover with the proper technology and the proper things coming in. So just imagine a situation where, say a person in a remote village needs a test done or some kind of a checkup administered. That today is still lacking, and that gap cannot be bridged by teleconsultation alone.
So I'll come to Mr. Subbarao. Did you notice any noticeable change during COVID in terms of tech adoption?
I agree with both Tathagata as well as Zainul. There has been a paradigm shift, and there's been an accelerated pace at which the baseline underlying technology got accepted. Okay, but that actually stops at connecting patients to clinicians, right? It doesn't go beyond that. Now, I read a recent McKinsey report which says that post-COVID, 70% of the patients would want to actually continue using remote consultation, right? But whether that happens or not entirely depends on how soon and how well we connect the dots and bring the entire ecosystem to a closed loop. Okay, today that is not happening. Like Tathagata rightly pointed out, right? A patient can actually reach out to a physician and go for remote consultation, but then if a blood test has to be done or if some other investigation has to be done, right, a patient still needs to walk into a diagnostic center, so it doesn't prevent them from actually entire remote consultation, right? As long as suppose we have a system where we can actually get the diagnosis to the patient's doorstep, right? So that will make a lot of difference, and that will ensure that the 70% that McKinsey talks about happens in reality. But I think it's a good starting point, I would say.
Dr. Srivastava, would you like to share your thoughts?
Certainly. I think, firstly, I agree with all. I think a lot of this is being referred to what the pandemic we just went through and how it accelerated in terms of basically telecommunications in the sense of video consultations and so on. And if you look at telemedicine, really has been talked about for a very long time. And it is truly really not telemedicine. It is just like what we are doing today, a Zoom call or some form of a video conferencing. So I think other than consultation, and so a lot of it is actually hyped up. And I think we have to look at it very holistically. And yes, pandemic taught us a lesson that things got accelerated, but it only limited, I think, as all other panelists have also said. I think where I feel as a physician and having now been involved in the robotics and the opportunity that exists actually partnering with the telecom companies, utilizing 5G or very high-speed connectivity. We have ourselves developed whereby we did single-arm applications using ultrasound, and we could do it remotely using 5G. So I think beyond the video consultation, of course, they are important. But firstly, you don't get the entire picture. There is nothing like a physician, seeing a patient. Now, can we overcome that part in such situation? Probably not, because we are all stuck. But what else could we do? I think so somewhere we have to go beyond this and really get into the telediagnostics and teletherapeutics. And so I think as we move forward and based on my own experience and what we are developing on the robotic front, we will actually be able to deliver the telediagnostics where a lot of these things actually can be done completely remotely controlled and in real time be interpreted or checked by various experts, and also possibility of delivering therapeutics in a tele possibility whereby through automation and utilizing AR, VR, and also various AI in terms of how do we arrive at certain decisions and what is the best thing for a specific patient. So I think it still is a long ways to go to when we talk of utilizing the technology, especially in the healthcare, to the fullest.
Right. So when we are talking about, connecting the dots with technologies, especially, emerging technologies. So another issue with Indian healthcare system is that it has been struggling with a deficient healthcare infrastructure for quite long time. So there are huge gaps in terms of, access, affordability, and quality of healthcare also. So I will come to you, Dr. Zainul. If you could, help me understand or you can tell us about how augmented intelligence can reduce some of these gaps.
Sure, Soma. So, you have to think about the Indian healthcare system really as two different, parts. One is the whole public infrastructure, and then there's the private infrastructure. Now, it does so happen that actually in the private infrastructure, our tertiary care setup is actually pretty good. It's world class. If there's a thriving medical tourism industry, in the tertiary care. It's really in the diagnostic space or the maybe primary care and the detection and the really early diagnosis of conditions where the infrastructure is lacking. Now, in the public side, there's a lot of good work happening, but just, it's the size of the country versus the GDP, part of the GDP that gets spent in the healthcare. That's really, there's a really large imbalance here, right? And I think it's well talked about. The government knows about it. I think it's just a matter of, maybe at some point the government just, putting the money down and spending more in health infrastructure on the public side, which I think they are doing. We are seeing that happening. Every budget, the healthcare spends actually do go up. Is that enough? I don't think so. It needs to be, it doesn't have to go as far as, some of the developed countries, but definitely we are lacking, at a global level, especially when you think about some of the WHO goals that we have set for ourselves. We need to do this as a country nationwide. Now, in particular, our company Tricog is focusing on cardiac health, and we we are sort of experts at diagnostics, in cardiac diagnostics, in both electrocardiograms, ECGs, and in echocardiograms, or also called Curie echoes. And what we've seen is that, yes, there was somewhat of a drop in patient flow in both the private and the government, in the public sectors, but it quickly picked up when things started moving back upwards. Now, in terms of actually improving access through technologies, things like augmented intelligence, artificial intelligence, machine learning, the technologies that are bringing to bear, I would say, they're I would like to use this cliched term in some sense, democratizing quality healthcare in some of the more remote parts, right? So where does technology help? We talked about connectivity, and Tata said very rightly that we are only doing connectivity. Now, in our case, what we are able to do is use that connectivity to actually bring patients, or bring care to patients, even at in diverse locations in tier 3, tier 4, even in the rural parts of the country, through government partnerships and things like that, NGO partnerships that we have been able to do. Now, how has technology helped all of that? I think one of the key areas that we have is that while we have great tertiary care systems, it's also very little. I mean, in our case, the cardiologist to patient ratio is actually very low, right? And so you've got all of these experts in these large cities, in the metros, and you can go to one of these tier 1 towns, and you actually have a pick of large hospitals that you can get to, of course, assuming that you can afford it. But if you are in anywhere in the tier 2, tier 3, further away, you are 80, 100 kilometers, and in the cardiac space, time is really of the essence. So the further you are away from a good treatment center, the harder it is to improve your chances of survival. So what we've been able to do through technology is really use the AI pieces to, I'll just use it, I'll use the term magnify the expertise of a few experts that are part of our team, to really give that access out to other parts of the country, and even now even the world, especially in Southeast Asia and Africa, where we are seeing good traction for the same kinds of technologies. So I think that's really been helping on both the ECG and echo parts. We are cardiac focused, so that's been our experience.
So, I would also like to know from you how AI can be, helpful in predicting diseases and, in the treatment.
Okay, so there's a whole new set of research, and you might call it basic science, but there's a whole lot of research where, because we have a lot of data now, we can be predictive about some conditions. Like, for example, there's a very an important condition called heart failure. All right, so heart failure is basically deterioration of your heart muscle. Now, typically, heart failure could only have been diagnosed with an expensive test, which is an ultrasound test called an echocardiogram. And it's expensive for a bunch of reasons. Of course, the expertise, the medical equipment required for this. Now, what's happened because of the amount of data that we have, researchers have found that you could take a cheaper test, like for example, an ECG, an electrocardiogram, and come up with a detection of HF with up to an 85% accuracy. It's not perfect. It's not as great as the gold standard, but an ECG is far easier to administer, and it can be done very cheaply and pretty much everywhere. Right. So it's areas like this that have become very exciting for us, where we are doing what we call cross modality detections of conditions which would otherwise be far more expensive or intrusive to detect, but you do it with cheaper means, with where less expertise is also required, and of course where it can be done remotely. So that's really helping actually in what we do.
What are your thoughts, Mr. Dasdar, on addressing this access and affordability gaps with AI? Also, you are working in the domain of diagnostics. So also, if you could tell us about how AI can help in reducing diagnostic time and errors.
Sure. So actually, I completely agree with Zainul on all the points that he mentioned. And what we work on is essentially what he said, but instead of cardiology, just translate it to pathology. It's essentially the same. So to answer your question, Soma, I'll take a real example. So we have a deployment of our solution, the blood testing solution, at a very remote village in Gudalur, Tamil Nadu. It's around 50-60 kilometers from Ooty, and that's a tribal belt. There are no hospitals over there. There is one hospital which has been catering to some 300 hamlets, tribal hamlets, and they do not have a pathologist. They do not have advanced lab equipments. So what our device does is that it basically now enables the doctors over there to prescribe a peripheral blood smear analysis or a urine analysis, which they wouldn't have done. And this can lead to early detection of things like acute anemia in children and different types of blood-related diseases in both children and adults. And we have seen this happening day in and day out for the past few months. And the pathologist has actually not gone to Gudalur. So the pathologists are still in Bangalore. Our own pathologists plus a few others who routinely help out that particular tribal hospital in looking at these samples and giving out a diagnosis for the physician over there to actually take the treatment forward. So this is I would say, a working and living and talking example of remote AI and AI in action. Now, the only sticking point there would be the cost. This particular hospital couldn't have afforded our machine. What made it possible was a CSR initiative from a large company. And they have pledged to do more. And the thing is that the cost is essentially a function of volume. If the volumes, if we have, these kind of technologies, not just us, there are multiple other startups who are working on this kind of things which can save people's lives. And if the volume of the adoption, the adoption goes up, the volume goes up, and that will automatically bring the cost down. So what we need is basically, especially for the underserved population, a push from the NGOs, from the CSR of corporates, from the government to increase adoption. That will enable the startups to actually build at scale and reduce the cost. And ultimately, it will help the end patient, the people who have no access to a doctor or to quality healthcare today.
Mr. Subbarao, I'll come to you. You are working in the domain of VR. So, my question to you is that how AR or VR can be effectively used in eye testing or treating vision dysfunctions? And also, since we are talking about affordability and access, how cost efficient are these solutions for the Indian healthcare scenario in particular?
Yeah, okay. So let me do one thing. I'll just take a step back, okay? Now, we are talking of this huge imbalance that is happening in the Indian healthcare ecosystem, right? On one side, you have 80% of the population which don't have access to quality healthcare. And on the other side, you have 20% of the population who have access, but then that access is being shared by the rest of the country as well. So we have reached a situation where there is too little that is being forced to be shared amongst too many people. Now, why is this happening? Because, see, we are not actually nipping everything in the bud, right? So, see, there are various diseases which could actually be sorted out right at a very, very early stage, okay? Now, where does that early stage happen? In PHCs or in GP's offices, right? Now, in India, for example, there are about 25,000 plus PHCs and about 150,000 sub-centers, right? Now, they are quite a lot. The problem is these PHCs are not actually connected to rest of the ecosystem, and there is no effective patient flow that is happening from one place to another place. So I'll give you an example, right? We have a product which actually analyzes eye movements, okay? Now, eye movements present some of the early stage indicators when it comes to various neurological conditions like strokes and tumors, okay? Now, today we have a product in about 400 plus clinical locations, but predominantly in private establishments, okay? Though 2/3 of those are in tier 2 and tier 3 cities, they are still at private establishments which are state-of-the-art infrastructure. Now, if the same thing were to be available at a PHC and as part of the regular health checkup, right? If a 2-minute eye scan could have been done, that patient could have been prevented from actually getting a full-blown stroke and actually cluttering up the private healthcare ecosystem, because they could have sorted it out at that stage. Now, if this effective connecting the dots happens, right, then a lot of problems could be resolved. Now, talking about VR, right? Now, VR is one technology which actually can play a pretty important role in actually solving this whole issue, especially in the field of neurology and ophthalmology, right? One classic example is there's something called as perimetry or visual field testing in ophthalmology, which is typically used to diagnose glaucoma, right? So this is a large piece of equipment costing about $20,000-$30,000, okay? And then what exactly does a patient do? Patient actually sits in front of it, and then there are light flashes coming from various places, and they have to just give tactile feedback when they see, if they see or not see, okay? And that builds some kind of a visual map, okay, on where all can patients see. Now, today, this entire perimetry is being replaced by $100 or $200 VR equipment, okay? And it can just be deployed anywhere, okay? And glaucoma is it's a huge issue, right? And if that can actually be sorted out at a PHC level with a small piece of equipment, then it's going to make wonders.
Okay, and talking about emerging technologies, I will come to Dr. Srivastava. So you are working in the domain of robotic surgery. So robotic surgery systems are particularly very expensive, that we know, and probably that's the reason that the market is also very small. So what are the things that are needed to democratize robotic surgery in India?
Certainly, I think you pointed out it is very expensive, and in fact, there's a company called Intuitive Surgical, and they produce Da Vinci surgical robotic system. And when I was in the United States, I used it for cardiac surgery and did a lot of cases there. And but from the Indian context, it is quite expensive. It sells for somewhere around 15 to 18 crores, and then procedures are quite expensive. And if you take, we have over, based on the last information we looked up, over 70,000 hospitals. Of those, 30,000 will be 150 beds and up. And these are all multi-specialty hospitals. And we have only 80 approximately robotic systems in the country over the last 20 years. And that is absolutely dismal. And I think of course, the technology came from California, and they enjoyed monopoly for the last, I would say, almost 18 to 20 years now. And now there are more companies getting in, and it's just like anything else. When you have monopoly, you pretty much control what you want. And if you don't have a global and a humanistic viewpoint, you will never pay attention to what the real need is. Or what do I need to do to advance the science, or to change the direction how the patients actually get care, or how we can look into the future Is this how we are going to keep practicing what we learned over the last 50 or 60 years, or we are going to change it? And somewhere I think we have really slipped. And essentially, there is a very uneven distribution of the robotic systems. It remains economy and country-centric pretty much. So almost like 93% of the current robotic system, approximately 6,000 globally, which is also not very much for a population of over 7+ billion people around the world. And that also over 20 years. So it's really, it's almost, it's pathetic that, there's such a wonderful technology that we don't have to make large incisions on these patients. Patients can recover. We can do complex operations of all kinds, including heart surgery. And these patients can go home in 1 or 2 or 3 days and back to their functional status. But unfortunately, it's a complex subject in terms of when it comes to the cost, is the investment, it's question of the people supporting, or, are you interested in innovation inside the country? And although we have a lot of slogans that are going on that you hear about, the Make in India and Atmanirbhar Bharat, but somehow, at least when it comes to medical devices, we are way, way behind. And all we have to do is look around in some very small countries, and they dominate the world in terms of providing technology, a CAT scan or angiograms or MRIs and on and on. Pretty much all of these things come today from outside. Do we not have ability in India to develop? Of course we do. If you look at ISRO or you look at the DRDO, there are talents there. But unfortunately, the medical device development is complex. It takes time, a lot of investment. There's a regulatory risk. There are already existing technology. And so sometimes it is not easy. And so as SSI, or SS Innovation, I made it as having lived in the United States and left to come to India, and really found that it was a challenge. We purchased the robot ourselves that time back in 2011 for around 9 crores or something like that. I couldn't operate on patients because they couldn't afford, even if you offered a free service. So we have now developed a system that will be almost 1/4 the price of the existing technologies. And we are really focusing on, like what I use the term, and I know democratizing is another one, decentralize excellence. Because see, I think everybody has talked about that, how in the tertiary centers, yes, you will find a wonderful group of doctors and doing highest level of world-class care, but it just doesn't filter through. And so I think using the technology, and particularly the robotic assistant, because the healthcare in underserved area or smaller towns or villages is a very complex issue. Patients or the surgeons or physicians who spend a lot of time studying, they want to go to a place where they can do the best, and we just don't have the infrastructure or facilities. So now the question is, how do you all this will take time. And it's a complex problem for not only the medical community, but the government also, because there's so many issues to deal with. And so only thing that I see that utilizing the technology, we can reach out, and yes, it will take time. It won't happen overnight. But if we put all of our energies into it and utilizing a lot of these new things that are in the pipeline or already exist to their fullest, right now, a lot of, it's a hype about AI and all of these things, but it's very limited. Where I see all of these things working is literally we have mobile units, or you place these, things, and over a period, just like cell phones became very cheap, or so many other technologies over a period became cheap based on the utilization. So this will also occur in the field of robotics. And I think as we truly kind of develop things within India, because of cheaper labor cost and also manufacturing cost, but we do have to invest a lot of money in high-level electronics. We miss that. We still have to import things from outside and pay huge amounts of duty. So somewhere I think this will change, but it's kind of the government has to focus, because somehow private industries and private investors don't seem to put a lot of money into this thing in India. We were lucky that we were able to raise money, and we are raising money. But I think, utilizing these technologies and placing them in the rural areas, remotely controlling them in every possible way. I think the thing you talk about drawing blood to, delivering literally, the diagnostic, having a robotic arm hold an ultrasound probe, okay, and literally you control it, program it, where AI will give you the best possible image every single time. You're not dependent on the human factor or human errors. And so all of these things actually, I think, will come, but it will take a tremendous collective efforts. And also, the other thing that sometimes, having come to India, we need to support things from within. And sometimes there is a tendency, well, can we do it as good as, United States or Germany, and that's kind of silly. It immediately shoots you down. Like you are put in a very different platform. Now you have to prove yourself. That should not be the case. They also started somewhere, isn't it? So we need to give encouragement to people, and I think it has to, at some point, become the government and private partnerships, because it's not just that we can produce robots at a cheaper price. Now, what about the electricity? What about the backup generators? What about the bandwidth? So all of these things actually will play part in looking at a bigger picture. And if you really want to change, it will take a lot of energy, but is it possible? Absolutely, because I think this will be the future. And India today really has an opportunity, if you grab onto it, that we can become a model that just because, we are not a very rich country, we are getting there, but we can deliver the care at much lower cost and decentralize this excellence whereby people don't have to travel from remote areas and so on. So I'll leave it at that.
So thank you, Dr. Srivastava. And, when we are talking about closing the gaps in the health tech or healthcare scenario in general, government is also giving a push in terms of, Make in India. So I would like to know from you all that how do you view the existing scenario for, medtech devices prototyping and testing in India? Whoever wants to go first.
Yeah, I think I can go because probably we have had some near recent experiences in this space, right? So we started off way back in about 2013. So typically in India, right, hardware is hard and medical hardware is madly hard. Okay, so I mean it's insanely difficult. Okay, and it was even more difficult when we started off, and it took us almost about 4 years for us to get our first, field version up and running. Okay, but the journey from there to here, right? If I look back to 2014 or 2013 and compare it to what is available today, I would say there is spectacular change. Okay, though that is quite insufficient, there is quite a bit of change out there. Okay, so those days it was really very hard for us to actually get a 3D rapid prototype. We had to actually wait for at least 2 to 3 weeks to get one small piece of mechanical designing done. Now, today that has changed. Government is also kind of invested. There are many ecosystem players like, say, CCAMP from NCBS, right? They have a sprawling campus here. And just last week, they opened a state-of-the-art hardware prototyping, rapid prototyping lab specifically for medical devices. And they've also gone a step further and actually set up a small batch manufacturing facility as well within CCAMP, which is accessible and open to everyone. Similarly, NASCOM, through its Center of Excellence in IoT, right? They've also set up a good lab out there, and they're also doing a lot of hand-holding and support. So these things were not accessible back then. So it's definitely changing, but then still, I would say, looking at the scale that we are staring at, it's quite insufficient.
I'll probably go next. So yes, we have seen a lot of change in the rapid prototyping field in the last few years. It's not just 3D printing, other things, more mundane things like CNC machining and all. There are lots of vendors who are there in Bangalore, Penia. If you just go to Penia, you'll find lots of vendors who can do very decent jobs for you at very, I would say, affordable cost. Where I think we still have a long way to go are two things. One is on the testing for medical equipments, the hardware testing. I'm not talking about the accuracy or the effectiveness testing, but the hardware testing, and the second is the large scale manufacturing. So in hardware testing, there are a lot of safety tests that any medical device needs to go through. There are things like electromagnetic radiation, electromagnetic conductance, and all these tests which need to be done. And there are certain facilities, and it is a well-known way of how to get those testing done. The thing is that rapid testing also helps in better designs, but the facilities available for such tests is very few and far between. And just to give you an example, there is a test for transportation which is called ESTA. It is part of the global the regulatory test that is done, and apparently there are only a couple of vendors or 2-3 vendors in India who do this for a country this large, and one of them is a sort of global vendor, and the price that they will charge you for that kind of a test, just to kind of shake the machine a few times and let it drop a few times to see how it stands up, the price that they'll charge you for it will make your eyeballs pop out. So things go like that. And when it comes to also manufacturing, I mean, let's say I want to purchase aluminum rods, or I want to purchase screws or ball screws or things like that. Unfortunately, we still have to go abroad. We have to go to either China. Now China is becoming very difficult because of multiple reasons. Then the other alternatives go to Taiwan or go to Japan. Yet, do we have the raw materials to produce these things? We do. And can we create the technology which can produce these kind of components in-house? I mean, not in-house, within the country at scale? The answer is yes, but we do not see it happening. Even in things like, say, injection molding and all, which are an essential part of any device. I mean, everything needs a cover, right? Where do you make that plastic for the cover? You still have to go to China. The vendors who are available in India just cannot match up to the quality that we have abroad. These are unfortunate, especially because these technologies have been around for quite some time. They're well known, well understood. There is absolutely no reason why it cannot be built at scale within the country.
So talking about these challenges, I'll come to you, Dr. Srivastava, since you are, doing your own, own bit in terms of Make in India. Would you like to, tell us about the scenario? How do you see it actually?
Surely. So I would say in hardware, there are, as has been pointed out by other panelists also, so there are companies that actually can produce good quality hardware. But you're talking about like covers and all of these things, these are bigger things. I think where we get into trouble, and we've been doing this thing for the last few years in India, and we have gone around literally all parts of the country to try to find things. And we do actually spend a lot of time. So yes, there are some good companies, but they are far and few between who can actually give you the precision that is required in medical devices. I mean, you're talking about literally micron level types of accuracies, or and must have a medical look and everything else that goes into the medical standards, because you do have to get through the regulatory approval process also beyond prototyping. So the standards are very high, especially in the medical devices, because they're going to touch a patient. And so unfortunately, I think we face challenges, and I think a lot of things have been already pointed out. The supply chain, we don't have the raw material, on and on. Now the question comes down as I mentioned earlier, electronics, we still import everything literally, from motors to drives to harmonic drives, encoders, connectors. I mean, these are all, so what really is surprising and frustrating, all of these countries started somewhere. If you take China and India, roughly around in the 80s, we were parallel. They took off and we kind of trudged along. So somewhere, I think the emphasis and the dedication and the commitment is missing. There's a lot of talk, but not enough action goes behind that talk or the allocation of resources. Now we can keep saying that we don't do it. So if we don't do it, we'll always be in that position. So if we just grab this thing, that yes, it is difficult, it is expensive, but at a point in time, we will have it. So we cannot keep just talking about the problems, that this exists and this exists and this exists. True. But what's the solution then? So the only way to turn this thing around, whereby India, and there will be so many other countries, I would say, in the next 10 years. And yes, right now we are going through a very global supply chain challenges, and everything gets delayed, unfortunately. And so, like we know some parts we are ordering, they're telling us 6 months out, a year out. Now, how do you, on one side, we want to just go gungo on launching our robotic systems. How do you do it? So unfortunately, so we've got to take this thing, and it has got to be sorted out at multiple levels. And yes, there are certain minerals or certain metals that just come from some different geographical, areas and so on in the world. True, but a lot of things actually can be done, because how do these other small countries do? Country like Germany or Switzerland, very small countries, or Japan, South Korea. They produce all these things, and we cannot. Sometimes you feel pretty embarrassed actually about that, why we have not been. And when we look at, and we can always kind of magnify the problem, but I think we need to really focus very systematically. And we don't have to solve every problem at one time, but we have got to start. Let's say we start making motors that are of that standard. Yes, we make motors, but they cannot be used in medical devices. We still end up getting all kinds of other electronics, we do. So I think, and that is the only thing that will actually bridge the gap. And we can truly become literally like other countries have succeeded in exporting to others. How come China is exporting to the rest of the world? Could we not do it? We have tremendous intellect. I worked in China for 3 years when the early stages of our development, funding and all that, a bunch of it came from there. But I can tell you, just having lived there, and yes, there's a discipline, they can do a lot of repetitive thing, but I think the creativity that exists in the Indian mind, we've got brilliant institutions here. Unfortunately, they are great in theoretical knowledge, but practical is actually missing. Because we bring these PhDs and so on, working with us, and we can see that. So somewhere all this has to change, literally from ground up. At the same time, there are a lot of rich people in India. I do not know why we cannot get a group of people focused together. And yes, it may cost a few $1 billion in order to produce whatever others are doing. But at a point in time, we will have it. And there will be a huge return on that investment when that happens. So I'll leave it at that, but I think that, I know we are doing our part, and, I keep pushing, and I'm very optimistic. I think, if we keep driving and encourage each other, I think we can get there. Hopefully in the next 5 to 10 years, we'll be absolutely self-sufficient.
Yes, we are all hoping for that. So Dr. Zainul, would you like to add something on, the medtech devices prototyping and testing scenario in India?
Sure. So I think, Dr. Sudhir has rightly put it. I think we, and Tathagato and Niranjan as well. So, I think things have improved considerably in the last, I would say, about 5 years. Before I was in India, I was in the US, and we were doing very similar kinds of prototyping. That was still, I was doing it at the lab level. And I remember, the way we would do this is we would have a circuit, we would have a design ready. In the evening, we would upload it, to a design house, and the next evening it would actually, turn up at our door, right? And everything's happening inside the country, inside the US. Now, the same kinds of things, currently we have to wait even for a fab house inside the country. It's 2 weeks, 3 weeks. It's actually cheaper and faster to do it from a fab outside the country. right? I'm just talking about this mundane thing that Tatak talked about, which is like PCB fabrication, which is so important for any electronics manufacturer. Especially if you're iterating your design at that stage, you do want that those sorts of quick turnarounds. I think things have improved a lot on the mechanical and the industrial design side. Tooling has become far better. Injection molding has become far easier. And I found that the pricing in India has become, actually better than places like China. However, the kinds of precision necessary, as Dr. Steve said, is just not there here yet, right? If you are building something that can work in the, in the 0.1 millimeter, in the 100 micron, tolerance range, you're fine. But as soon as you want to go to 50 microns, 10 microns and below, it's just not there. You just can't get it, right? You have to go out. It's not that it's just not possible. I know of a few companies that are in the aeronautical space that are building components for the large airplane manufacturers in France and in the US as well. So it's not that we don't have the expertise or the machinery to do it. It's just that we don't have the investments to put in the capital expenditure, to put in upfront, to have the machinery that can get that sort of precision. And of course then you need to have the expertise and the skill to operate those machines. If they're not simple to do, even if you had the best machines in the world, right? So there's a lot of there's a lot of pieces in the ecosystem. I know that there is a lot of talk. I'm on some groups where there is some walk as well. There are government entities, especially in the Department of Telecom, places like that, where they are working with with the startups, with small and medium SMEs, to actually alleviate some of these concerns and to even bring in investment through grants and things like that. It's getting there. It's not great. It's not a huge push. I think Atmanirbhar is a good push in the right direction. I was talking to one of the fabs. I'm not going to put a name, but in the geography in Shenzhen, and they're like, the government actually subsidizes the high-end equipment for us. They don't have to pay for it. The subsidies are 50%, 70% subsidies, just so that they can get the high-end equipment. And the equipment is not made in China. It's made in Japan or in Germany or in Korea, and it's imported into China. But then they are able to, create quality products from that side of machinery. And, ironically, you try to import machinery from Japan, Germany, you'll be slapped with duties here, right? Forget about subsidies. So there's some of this thinking that has to change. Now, I also know that we are slaves to our own failures and successes. The government wants 100% success on every project that goes through, and of course there's someone on the line if that doesn't happen, right? And so there's all of that combines together. And if we let some of our guard down and allow some failures, but then let the process sort of kick in, with some of these grand challenges and contests. And there's good people in the country, and they want to change, like Dr. Sudhir, all of you. They want to make this change. They want to make this happen. They've been doing this. They've been at it for decade or plus, right? And but we just need a little better in terms of support and ecosystem. Funding, financial is always a big deal. If it comes from the government, if it comes from CSR, if it comes from some of the HNIs, that'd be great.
Gentlemen, many thanks for joining me today in this conversation and sharing your insights. Stay with us for more such interesting conversations. Thank you.
I would like to thank all the panelists for such an engrossing discussion. Technologies can help reduce the burden on our healthcare infrastructure and drive down the cost of healthcare through increasing efficiency of diagnosis, treatment, rehabilitation, and monitoring of patients, as well as effectively delivering care across the patient journey from institutions to home. Drone-based medical delivery systems, telehealth, and telemedicine are some examples of innovations that are leading the way in bridging the access and care delivery gap. Through wider implementation and adoption still needs to be pushed forth. To discuss how drone taking healthcare to the last mile, we have with us here today Mr. Swapnik Jakampudi, co-founder Sky Air Mobility, and Mr. Abhishek Burman, founder and CEO, General Aeronautics. The panel will be moderated by Somata, Associate Editor, PCQuest and CIOL.
How drones can support the healthcare logistic infrastructure to be faster and more efficient, especially in the remote and rural areas. To discuss this, joining us in the panel today is Mr. Swapnik Jakampudi, co-founder, Sky Air Mobility, and Mr. Abhishek Burman, founder and CEO, General Aeronautics. Thank you, gentlemen, for joining us today. So we all know that the government is give a big push to the drone ecosystem and come up with new policy and regulations. If you could, Abhishek, I would like to come to you first. What do you think about, how the government policy and regulations is going to open new possibilities for, drones in the healthcare ecosystem?
Sure. Thanks, Oma. So, I would say the drone policy 2021, which has come up on August 25th, that's the date, if I remember right, this is the best thing which industry could have asked for. And it is, of course, it is built on the basis of trust, and there is no intrusive monitoring, etc. And that makes ease of doing business in this sector much simpler. And of course, the sector, of course, in the present context, we are talking about healthcare, that definitely gets majorly benefited, because the earlier regulation in terms of the requirements of no permission, no takeoff, all these things are totally eliminated in the present regulation. Of course, I'm sure there are security implications, and once it comes, it would be implemented all across, but government is going to give industry a time for about 6 months to implement this. So that's very welcoming. But what it makes, much easier, I would say, for industry to do, because there is a very clear definition of so-called red, yellow, and green zones. Thereby, it makes it much easier for us to operate the system in a particular location without any further clearance requirement, be it from DGCA or any other place for that matter. So that way it makes operations much easier. In terms of doing business, there were challenges in terms of number of forms which one needs to fill in to get permission. That is reduced significantly. I don't want to go into nitty-gritties, because there are lots which is already said in the media and it's available in open, which people can see. But the best part, I would say, it is perhaps the first time where regulation is much ahead of industry. And now ball is in our court. When I say our, I mean the industry side. And we need to ensure that we really meet the intent, what was behind making this. So that is that's what I would want to say on this.
Swapnik, what are your thoughts? At one point of time, we thought we missed the drone bus, and now we are again on the game again. So what do you think?
Yeah, I think I concur with Mr. Abhishek too. And I think he has put it in a very good way that the ball is in our court now, right? So we have to catch up to the regulations now. And if you see, the government has very methodically and planned out 3 different regulations or new things that have come out with. First is the new regulations, which has considerably reduced the number of permissions the government organizations we need to speak to get permission, or the forms that we have to fill out. Second is the PLI scheme that they're introduced, so that the manufacturing industry for a drone is, there's a catalyst for it to grow. Right. The first rule, they have created demand, and now they want to take care of supply for the PLI scheme. And the third release that they did was the green zone or yellow zone or the red zone, right? And that is a massive improvement for us, because it gives you a lot of area where you can fly. So that way for us, if you see, it's very good. They've created domestic demand for drones, right? They're creating a market for supply by encouraging manufacturers by the PLI scheme. So overall, it's a very exciting time for us, because it has given us an opportunity for us to learn. Right? We've been able to do so many trials that we didn't have that experience before. One of the major things that whatever we had was very limited or theoretical, what we were learning from other people or internally. Now from the Telangana trials we did, there's a lot of practical knowledge. So that given us a lot of freedom to learn from it and then evolve the technology accordingly. But overall, it's a very exciting time. And I think the amount of work we have done in the past 2 months has been more than the amount of work we were able to do the last 1 year. So which is a very good news for us and the whole drone industry.
So another thing, I wanted to ask you both that how it helps, how the drone, providers, drone technology solutions provider, drone operators can, enable the healthcare infrastructure in terms of, medicine delivery, emergency supplies delivery. And how do you, gain experience from these trials that you are, doing with different governments, state governments? Swapnik, you would like to go first?
Yeah, sure. So definitely. So to kind of give you a background of the trials that we have done through the Medicine from the Sky program that the Telangana government has done. The whole intention is the Telangana state government wanted to connect the different community healthcare centers to the primary healthcare centers and a smaller level healthcare centers that are set up, or district level hospitals that are there run by the state government, right? So if you see the trials that we did in Vikarabad, our base of operations was a community healthcare center, where essentially it had the cold chain capabilities, it had the COVID testing facility, it has a diagnostic lab over there. And from the community healthcare center, you connect into different primary healthcare centers, smaller ones in like a village, probably with 500 or 600 people. Over there, they don't have the capability for cold chain. They don't have the stock for medicines. They don't have diagnostic center or COVID testing facilities over there. So most of the samples are collected there and they're sent to the community healthcare center every day. So what we were establishing is a supply chain logistics with them, in the sense that we were able to transport medicines whenever required on demand. And if there were any diagnostic samples that had to be sent from the primary healthcare center to the community healthcare center. So one of the healthcare centers, it was taking us around 35 to 40 minutes by road. By drone, we were able to cover by 15 minutes. So it's a 10.5 kilometer from point A to point B straight by a flight distance. But otherwise, if you're going through the road, you have to cover a lot of roads that potentially, you will have a railway track. Maybe you stop over there, or if it's raining a lot and there's a road cut off. Right. So then from the community healthcare center, we're connecting to different, not just one example I'm giving. So if you see in Telangana, there are approximately 885, I believe, from 2000, what we got from studies in 2015. There are 885 community healthcare centers and primary healthcare centers. And all of these need to be connected. And most of the places you probably won't have anti-venom if you need to be, right? Vikarabad has a reserve forest. And if you need, in emergency purposes, some anti-venom for, a snake bite or a scorpion bite, which might require a cold chain facility, or they might not have stocks, and they're available in the community healthcare center or the district healthcare center, or blood needed, we can immediately, supply that to drones. So this is what we had done, and this is what the value we are bringing in connecting to them. And recently, if you see, there was an individual agri pilot in Telangana. There was a medicine that had to be supplied to an infant. and the police needed immediately to be sent to him, but the main access to the village was cut off because of the floods. And the agreed pilot, even though it was not, he was not meant to it, he was immediately able to help them by using the drone to transport it across the river, which was blocking off the road. Ideally, once the full stage of execution or delivery of the full project is done, drones would have been able to cater to it, and he was able to demonstrate that it's done. So that way, I think we'll be adding a lot more value. And once we go to Northeast states where the terrain and access by roads is very limited, you'll be able to add a lot more value over there.
So Abhishek, when Swapnik was talking about connecting the healthcare facilities, there is extreme challenge we have seen in terms of emergency medical care. So you are also working with an idea of connecting the ambulance network with drones. So could you tell us about how it will help the healthcare or healthcare ecosystem in general, or emergency in responding to emergency medical care?
Sure, Suma. So the use case what we are working with GVK MRI, and this was led by Pennsylvania State University with Children's Hospital of Philadelphia. Here the use case is in case of primarily for highway related accidents, wherein we have in India, if you may know, about 1.5 lakhs deaths are reported just because of highway accidents. And if you see the majority of those deaths, the primary reason is excessive bleeding before any first aid could be provided to the accident victim. Now, and I would say the 60% of cases are like that. And if you see the present state of infrastructure, you have stretches going up to 15 to 30 kilometers where you have certain ambulance. So, the challenge there is, if you see, even if you take example of 108 ambulance service, the max speed which is permitted on highway is about 70 kmph for this ambulance. So that's the max speed they can travel. Now imagine you have a situation which is about 10 to 15 kilometers away. And typically the moment they get the information, time it takes for them to start is about 3 to 4 minutes. And then the traveling time, whatever it takes. So it is anywhere between, it can take between 10 minutes to 30 minutes, depending on the distance. And generally it is said that if you can stop the bleeding within 7 to 8 minutes, which is so-called golden period, then the chances of survival increases significantly. So this was the problem statement which was given to us. And then we did one demonstration for 5 kilometers, and now we are extending it to 15 kilometers. Idea is that drone must reach this 15 kilometer stretch within 8 minutes. And there is a kit which is called active blood control kit, which is specially designed by this entity, as I mentioned. And drone would drop the kit there. And there is another important statistics here. What happens in India, again, what I have got from 108 service, even though when we see there is an accident on road, it's only about 4 to 5% of the people who really come forward and help the accident victim. Now, reason could be multiple. One is why to get into this kind of things where I will be called to police station, etc. That is one type of thing. Of course, there are rules, but not everybody knows about it. The second part is many are unsure that what kind of first aid or should we provide. So putting these two things together, finally the end result is only 5% of the people really come forward to help the accident victims. So that's where what we felt, that if we could have a medical practitioner connect with the bystander, and wherein he could guide the bystander to provide the first aid in a right manner. With that, what would happen is the participation in any such thing would increase, because one, your entire what you are doing is getting recorded, so there is no chance of you being considered to have done something wrong. And number two, that you are not, somebody is assisting you on how to go about it. So that's where what we are trying to do now in this phase of the program, that first is that 15 kilometer you need to cover in 8 minutes, which requires the speed of the system has to be in excess of 200 kilometers per hour. It has to be really fast. That's number one. Number two is once the drone reaches this, it through the 4G, presently 4G, eventually 5G, the doctor from other end can connect with the bystanders and then help them in assist them rather to provide the first aid. Now, another challenge we have in India, suppose the ideal thing would be that drone goes, lands there, then the video is transmitted back to the 108 service. But the challenge is then the drone's life is at stake. If you land in a place like this and you never know whether it would come back. So that's unfortunately today is the situation. I'm sure with awareness things would be better. So that's where we are, as of now, we are not landing at the site. And what we are doing is once we reach there, we are trying to do the hover. Hover is basically you are being almost static, but you're not landing and switching off that somebody can pack you and take you. So here you are hovering there and video and audio is getting transmitted. So that's the idea. It has its own challenges because when you hover, the noise which is created by the propeller, how to mitigate that noise because you are also connecting the audio system. So that's the end goal of this program, that you reach 15 kilometers in 8 minutes, you drop the active blood control kit on the site. And the third one is that you connect the doctors from the other end who could guide the bystanders. So that's the project. We are into it. And we are hoping that early next year, we should be able to do this demonstration.
Okay, I would also like to know from you another thing. We were talking about, emergency response, in terms of emergency care, how we can respond faster and act faster. And Swapnik, you were already doing trials with, different state governments. So we have, on one hand, we have excellent set of innovators in the, drone ecosystem, and we have enough, health tech innovation going in the healthcare space also. So what are the, challenges on ground that you are facing, or opportunities are endless? We know about that. But what are the on-ground challenges you are facing? If you could just touch upon that.
So, in fact, this was a project, what I just mentioned was afterthought. To start with, we wanted to do organ transportation. That was the original intention. The challenge we faced there, in fact, for that matter, any emergency response system, what becomes very important is reliability of the system. So if you take, say, organ transportation, for example, and we were looking at heart as one possible candidate, because the reason being, it has very less self-life. And from the point of the, say, harvested or place to the hospital, if you have to navigate the Bangalore traffic, you never know whether it would reach on time and whether it would have the life or the organ would be in a shape which can be utilized. So their drone makes a good sense, because otherwise there is, of course, the concept of green corridor. It was done in Bangalore. Such transportation was done, but that affects the entire, the traffic system, etc. So drone makes a lot of sense there, but it is important to realize that such operations are highly critical in nature, and the system reliability of one such mission, it needs to be as high as a transport aircraft which ferries human being. The reason is, that typically the organ, say like heart, has a self-life of 3 to 4 hours. That's one. And what happens when it is taken out from the harvesting place to the hospital? Before it reaches hospital, you will find patient is already in OP and they would have started the working on him, right? So imagine a scenario where the mission fails and heart doesn't reach the hospital. So it's a highly, I would say, in a way, safety critical mission. But so what it calls for is very high end of reliability. Now, reliability is linked with the type of components used in your design, which is not really the most commonplace available component what we use today in the drone industry. It's in nascent stage. I'm sure we'll reach somewhere there. So many of the design requirements to have a reliability of sort. It's like, we talk about how many nines after 99 is the kind of measure of reliability. So we talk about 1 in 1 million type of failure is what is permitted, even for, say, transport aircraft, etc. So to achieve that kind of reliability, the kind of component what you need, that also demand that kind of reliability, which is, again, if you have to use, it's not that those components are not available. If you have to use that, the cost viability of a solution like this becomes pretty challenging. So that is where how to make the system reliable to do this kind of emergency operation, that is definitely a big question. And I'm sure the entire industry, we are maturing, and the reliability of the subcomponents are also improving because demand is increasing, as Swapnik was mentioning. So that is a bottleneck, I would say, when it comes to any kind of this kind of highly critical mission where you have, life and death is dependent on that. So that's one primary challenge. What I see today, if I have to do a transportation of that nature, I would say apart from reliability in terms of regulatory aspect, it was a challenge some time back. It's no more for sure. And even in terms of conceptualizing the design or manufacturing the system, I don't see that as a major challenge anymore in India. Of course, we are dependent on some of the critical components we end up importing, because though demand is increasing, but it has not reached a stage where all the subcomponents are getting manufactured in India. So we end up importing. So there are challenges related to supply chain, etc. But I would say those are definitely manageable, and things are getting definitely better and better. So that's what I would say on this point. Thanks.
Swapnik, you are talking about exploring the difficult terrain of Northeast. So what are the challenges in terms of getting into the rural deep pockets like rural and remote areas and areas like Northeast? So how do you want to take that challenge, and how do you want to innovate further?
Yeah. So, like you mentioned, the terrain, say, suppose you're going to Northeast India, I think at least what we envision the biggest challenge for us would be the communication, right? How do you maintain that communication with the drone at all times, and how does the drone internally be able to navigate accordingly? So that I believe that is one of the biggest challenges we will have to work on, address it. So suppose right now in Telangana, where we did face some disturbances because of local conditions. Maybe there's a high tension wires. Maybe the frequency of communication we had, the strength was dropping. But I think once you go to hilly terrain, it will be a lot more challenging over there. So we have to work and figure out a solution where we always in touch with the drone, the communication is maintained, and the reliability on the components, like Mr. Abhishek mentioned, is very important on the other components. And we also need to have the reliability on the technology where if there's any contingency needed, you're always in touch with the drone to take over if need be. Because right now, most of the medical deliveries beyond visual line of sight deliveries are autonomous flights. The pilots are there in case there is an emergency failsafe that get triggered, and the pilot needs to take over. So communication needs to be always established, and I feel that would be one of the main challenges that we will be working on addressing. There is technology currently there, but we'll have to figure out which is the best way for us to go forward and work on it. So I think that's where we'll probably do. Otherwise, the flying of the drone and in general, it's a very reliable and stable. We have enough hours to maintain that. So for the communication, the manned aircrafts might have solved it, but there might be very expensive solutions for us. We have to find a solution where it keeps the cost down, so that our charges to end customers or clients is not too high. We are making it economically viable. So that's where I think our major challenge would be. The next one is to make it very economically viable for everybody, so it's accessible to everyone.
Okay, so just last question before we end. We are running short of time today. So we are talking about drones, drone flights, and how it can enable an immersive delivery model in the healthcare ecosystem. So how far are we exactly from reaching that stage?
So I think it's hard to say right now, but I think technology-wise, we have most of the solutions available to us now. Is just kind of fitting the puzzle in the right place, right, and getting all the ecosystem ready and getting all the players involved. So I think the main challenge would be putting practically doing things and talking to people and operationally setting things up. So I think that's the stage we are at, and then slowly we have to evolve into different category of drones which are able to do higher payloads and longer distances. So I think the next stage of trials that everyone will probably be doing with higher payloads and longer ranges. So we are probably halfway there, if you ask me my estimate. But I think the most of the challenges will be in setting up the operational requirements, doing mapping, talking to different people and educating them and what is required at the takeoff and landing sites, making sure the communications are reliable with the drone in general, and then making sure the components that we get locally in India also is very reliable, and we have to prove a track record. Give the public and the government and all the stakeholders the confidence, and ourselves also, that we were able to demonstrate the capability. So that's where we are at. I think most of the pieces are available now. We have to work on proving it and proving it multiple times over, so that safety track record is available in all the different parameters that needs to be tracked.
Abhishek, I have just one last question for you, that you are working with different partners and customers. So how, in general, how is the response from the healthcare providers or ecosystem players? I mean, we are all talking about cutting edge technology, but how receptive are they in terms of embracing these new solutions?
Well, I see that's quite positive because, of course, though at GA we are doing this, but that's not the primary forte of GA. We are primarily into agriculture. But so far, whoever we have interacted with, be it 108 Services, of course, they are our partner in this. But apart from that, various hospitals we work with. And we, along with Indian Institute of Science, we had also worked on an organ box, which is to increase the life cycle of the organ, which can be carried in a drone. What we have seen overall, it is very positive because there is a clear need, as Swapnik mentioned, especially in the areas like Northeast and other places, or for that matter, any emergency response where there is the time is the key, right? So there, if you can save a life by whatever you do, and at the end of it, if you can save a life, I think nothing can be more fulfilling than that. So need is clearly established. It's a question of how reliably we can perform the mission. And I would say, it would be good to do it in certain phases, wherein even for that matter, reliability, what I was mentioning of making it equivalent to bigger aircraft. As long as it is, we understand our system well, we know when things are likely to fail. And if you can characterize those systems, you can do it in stage wise and perhaps handle those things today with more of proper maintenance, etc., where I know very well what my system can do. And slowly it might take some time, but I think we are on the right track. As I said, on the regulation side, absolutely no problem. Whatever best we could have asked, government has given us. On the innovation side, I don't see any dearth in India. We have to, of course, put our act together because still things are in silos. People are doing different things. So I think there is also need of some kind of cohesive way of working, which will give us advantage over other neighboring countries. That would definitely make things better. And I think with this energy and the push from government, it's not too far. Perhaps a year or two down the line, you will start seeing all these things turning into reality on a regular time frame. Yeah. Yeah.
Well, on that thought, we would like to end our discussion today. Gentlemen, many thanks for joining us in the discussion today and sharing your valuable thoughts and inputs on how drones can open a new world of possibilities for medical and emergency supplies delivery.
Thank you, panelists, for that futuristic outlook. I now hand over the stage to Sunil Rajguru, editor PCQuest and CIOL, for his concluding remarks and the vote of thanks.
That was quite informative, useful, and power-packed. We hope you enjoyed it and it will enlighten your understanding of the health tech industry. Special thanks to National Health Authority CEO, Dr. R.S. Sharma, AIMS Director, Professor Randeep Guleria, Narayan Health Founder and Chairman, Dr. Devi Prasad Shetty, along with a personal thanks to each and every esteemed speaker and panelist. But the biggest thanks is to the delegates and viewers who made this event possible and a stellar success. I would like to express my gratitude to our partners. Presenting partner Dell Technologies, digital transformation partner Accenture, academia partner APJ Education, knowledge partner CIOL, all without whom this conference would not have been successful. This is part of our PCQ Emerging Tech series, and we will promote technologies like EdTech, AgriTech, EVTech, Drone Tech in the coming days. PCQuest, India's premier tech magazine, has also entered its 35th year. We have been at the forefront of all tech changes since the last few decades, and we will continue getting you the views of the who's and who of the tech industry during this period and looking at timelines of tech transformation, which India has seen. So finally, thank you all for coming and making this a success, and hope to see you again soon. Bye, and have a great day.
With that, we come to an end of this session of PCQuest Health Tech Forum. I hope all of you could take back a lot of information, a lot of techniques, a lot of futuristic outlook that can be used in changing the healthcare landscape of the country. It's a wrap from us for this year. Thank you so much.